Welcome. I would like to acknowledge the traditional territories, the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation, the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta, Region 3. When you came into this space, you will have likely noticed the mural overlooking the atrium. After multiple failed attempts to break through bureaucracy for approvals as well as to find funding, this mural was painted by a team of Indigenous artists from different nations that included a senior artist who mentored 3 junior artists. Elders and Indigenous voices from different nations co-constructed the who, what, where, and when of the project that was then executed by the Indigenous Local Global Health Office team. And what we see now represents a much broader perspective of medicine than we're used to. That includes everything around us, from the natural environment, our relationships, and the connections to each other, our history, values, and the land on which we live, all that influence our health and sense of wellness. The mural and how it came to be in many ways encapsulates social innovation and why social innovation matters to the O'Brien Institute and to public health. Holding fast to immutable values while stewarding change, marshaling resources, building diverse teams comprised of different knowledges, identities, and ways, collaborative, community-engaged work, improved health through the determinants of health, and doing this in a way so that when we finish, we're stronger as individuals and as a team to continue to enact our shared values. Welcome to this event on social innovation. And to kick us off, we'll welcome Dr. Katrina Mullaney, our Associate Scientific Director for Population Health, who has $25 million in grants, multiple social impact awards, and founded the Social and Structural Vulnerabilities Hub here in the Institute. Dr. Mullaney.
Thanks, Elaine. Good morning. It's nice to see so many people in the room, and I think we have quite a few people joining us virtually as well. I just wanted to take a couple of minutes to just orient or reorient you to the big goals that we have within the O'Brien Institute for Public Health that we're working on right now. Very briefly, I'm very excited about today and our conversations around social innovation. And we have, I think, a pretty amazing agenda. And so hopefully we all feel stimulated and energized and step away from today with some excitement around innovation. So welcome and thanks for being here. So again, my name is Katrina Mullaney, Associate Scientific Director for Population Health within the O'Brien Institute. I formally joined the Institute leadership team last spring, but have been a big fan, big advocate, and big supporter since I joined Community Health Sciences about 8 years ago. So this is a really exciting time, I think, for us with our new strategic plan. So I just wanted to highlight our 4 big goals and some of the work that we are engaged in and thinking about and moving towards over these next few years. And so our first goal, in no particular order, better healthcare. And so better healthcare is really about sustainability of our healthcare system. So also some exciting news for W21C, which is Ward of the 21st Century. Dr. Mary Brindle joined the team as the lead this past summer and brings some really interesting and innovative ideas around mobile health and electronic health or virtual health, and is currently leading a major innovation fund. And so if you have an interest in mobile health or virtual health or electronic health, e-health, I hope I said that right. Thank you. Someone just nodded. Thank you. If you have an interest in that kind of work, please do reach out to the team at W21C or reach out to anyone within O'Brien, and we're happy to make that connection for you. So there's some exciting work happening around those initiatives now that Mary has joined our team as well. And so healthier populations, I could talk all day about this one. This is the area of the strategic plan that I lead. And this is really about people, and it's really about equity and health equity and social equity. And so we are thinking a lot about who needs to be part of these conversations. We are launching a health equity hub. And so we envision this as a platform for like-minded researchers interested in health equity to come together and build capacity within our institute, within the University of Calgary, and more broadly across the country around health equity. And so the ultimate goal will be a health equity hub, and our hope is to invite some U of C scholars to join us. We'll be doing a systematic review around health equity, what it means, so we can have some definitions about that. It's a very sort of big term, so we want to be really clear what we mean. We'll invite a group of scholars to help us think about it, and then we'll go more broadly in terms of inviting people in. We're very excited that a Tier 1 Canada Research Chair in Black health and anti-racism and discrimination is joining our team next year in the spring. Her name is Dr. Bukola Salami. She joins us from U of A and is also going to bring some new energy and some excitement to the work around anti-racism and discrimination. So stay tuned. If you have an interest in health equity and I don't reach out to you in these next weeks, please reach out to me because we would love to have you join us. So our next big goal around thought leadership, we have launched a health policy center, a health policy institute. So we are building our capacity around health policy, which is really about changing systems and changing structures and changing the mechanisms that govern the delivery of healthcare and health services. And so this is where the rubber hits the road and research turns to action. So we're very excited about our Health Policy Institute and forming partnerships across the university and outside the university, of course, to do this important work. We had a record-breaking success with our members around grant funding this past competition. And I think Tom is going to speak a little bit more to that in a moment. So very exciting times around success and accomplishments and really sort of great impact focused work is happening right now amongst our members. And of course, events like these are just a wonderful opportunity for us to reconnect, move forward together around some common goals, and hopefully, if you are members of the Institute, find ways for you to feel connected to the work and a part of the work. And any and all ways that you would like to be connected to the work, of course, you can reach out to us at any time. And so our final goal, and then I'll stop talking, is around operational excellence. And so this, of course, is our institute and our infrastructure and our team and our members and our purpose and all of that. And so we have a couple of new research interest groups that have joined or are in the process of joining us. One related to sex, gender, and women's health research, which is led by Dr. Erin Brennan. And we have a transplant wellness program actually about to be launched. And that's Deborah Isaac and Stefan Mustada. The Institute does offer Catalyst funding a couple of times a year. Members can apply for a small grant up to $15,000 to launch a new program of research or to change directions in your program of research. And we've just had one competition close for the fall. And so going through those applications and getting some actually really exciting and interesting projects coming forward related to innovation and related to health services and healthier populations. So I will pause there and I will invite Dr. Tom Stelfox to join us to talk about some celebrations within the Institute right now.
I think I know most of you. My name's Tom Stelfox, and I'm Scientific Director of the O'Brien Institute for Public Health. And for me, this is special because this is the very first in-person event that I've been part of since taking on this role almost 2 years ago. So thank you. And I'd say there's nowhere else I'd rather be than here with you today. And the reason is because as an institute, fundamentally, our strength is in our people. And today's a chance for us to reconnect and to think a little bit about how we can continue to build a community that advances public health through research excellence. Now, today's day, we're very fortunate to have Karen Benzies, who's leading social innovation for the university. And so we've taken advantage of that. And we're going to think a little bit about public health and social innovation. It's an area of strategic focus in our plan, with the idea being, how can we help to build an ecosystem that fosters healthy innovation, that allows the work that you do in research to have a greater societal impact? Now, we've got over 500 members that span 10 plus schools and faculties across the university, another 500 trainees, highly qualified personnel, and many of you do applied research. And so this creates tremendous potential for innovation and for impact. And to highlight how that might look a little bit, I thought we'd start with a little bit of a celebration of success. So the first thing I want to highlight is, I don't know if any of you have seen this. There are some copies out front. There's virtual copies available as well. This is the 2020-2021 biannual report for the Institute. It covers really the 2 calendar years where the pandemic had its greatest impact. The team did a great job of sort of synthesizing some of the key activities of our members. Can't capture everything, there's too much, but it's a good read if you want to see some success stories. So please have a look at that. Since then, I want to highlight just one big success from the summer, and that's that our members continue to have record-breaking success securing funding. It's kind of remarkable. Every competition, I think we can't do better than we did before. We're going to have to step back. It's like the law of averages. Where's Tolo, right? Like we regress to the mean, right? But this past summer, we learned that 14 of our members secured 15 awards in the open grant competition from CIHR, securing over $4.5 million in funding. Really impressive work, and a testament to their commitment. It's also a testament to the internal peer review process here. So Jamie Day, our administrative director, has been tracking success over years. In the past competition, over 50% of our members who participate in internal peer review were successful in their grant. So you may think, well, that's a one-off, but it's ranged between about 30 and 50%, way above funding averages at a national level. So thank you for those of you that are helping with the internal peer review process. And I encourage all of you to consider it when you put forward future applications. Okay, so now we're going to switch to the O'Brien Awards. We have 5 categories that we have awards for every year. 3 research related, 1 societal impact, and 1 related to sort of contributions to the Institute. We had several nominations in each of the categories. It's really a testament to the talent and dedication of our members. What I'm going to do is I'm going to announce the award winner. And just because we could go on forever on these, I'm going to give you one piece of information that I learned in preparation for today's presentation. We're going to call them up. I'm going to do elbow bumps with people who are comfortable, just because sequentially shaking 5 people's hands right after Thanksgiving may not be the best idea. And then I'm going to invite them to say a few words. Okay. So our first award is for the 2022 Emerging Research Leader. Oh, where am I going? One more. Yes, there we go. And this year's award winner is Dr. Nazar Forbes. Nazar is a gastroenterologist who joined the Institute in 2017. You may have noticed his picture on the previous slide. He secured another CIHR grant this past summer. Fantastic work. And what I learned about Nazar is that he has created the first prospective patient registry for advanced endoscopic techniques in the world. So far captured over 4,000 patients in 9 centers covering Canada, the United States, and Australia. And that work is already being used to influence clinical decision-making. So congratulations, Nazar. Please come up and accept your award.
Thanks so much, Tom. So 2 things. 1, I haven't prepared anything, and 2 is I'm actually post-call after the 4-day long weekend. So as of 40 minutes ago, I'm officially free. So it's really humbling to get this. I can't thank you all for your support. Jamie, Tom's spot on. I think a huge reason for a lot of our success is the strength of the internal peer review program. So I'm officially proud to now say that I can join the ranks of Dr. Mullany, Tom. They've had 25 million, 50 million in support. I've now reached about $25 in support. But this is really, really humbling, and I appreciate it. And just really grateful to my family, my 3 girls, and thank you all.
Okay, so our next award is for the 2022 Mid-Career Research Leader Award. And this year's winner is Dr. Tolu Sajobi. Now, Tolu came to Canada in 2007 to do graduate studies. 5 years later, he had finished a master's and PhD and had taken on a faculty position as a biostatistician. And since then, he hasn't stopped. He has huge amounts of money and grants, lots of publications, engaged in lots of knowledge translation activities, very successful. But what I learned about Tolu this past year is that not only is he an academic, he's an author, right? And so very impressive. I mean, who has time to read, yet alone write in their spare time? And so congratulations, Tolu. Please come up and accept your award.
Thank you, Tom. Morning, everyone, and thank you for this award. It means a lot. I'd like to start by thanking Dr. Fiona Clement for the nomination. I didn't see that coming, but thank you so much. Also, I'd like to thank every collaborator I've ever worked with. I'm a statistician, and so the beauty of that is that I get to play in everybody's backyard. So thank you for allowing me to do everything that I do. Also, I'd like to thank my students, whether my current lab students, graduate students, past students, students I've served on their supervisory committees, students I've taken 1 or 2 of my courses. You guys made me the person I am today. So this award is also for you. I'd like to thank my boys. They keep me busy, and obviously my wife as well. And most importantly, I'd like to thank the patients who are the center of the focus of the healthcare system. Even though most times we don't act as if they're the center or the focus of the healthcare system, they continue to inspire my work on measurement and analysis of patient-reported outcomes. And I hope that I can continue to advocate for the integration of patient voices into how we deliver care in Canada and internationally. So thank you, everyone. God bless you.
Okay, so our third award is the 2022 Research Excellence Award. And this award is for someone who's now had many years of demonstrating research excellence. This year's award winner is Dr. Irene Ma. Now, Irene is a general internist. She's an educator and educational researcher. And her area of expertise really is point of care ultrasound, something that's sort of pushing the boundaries of what has been traditional physical examination and healthcare delivery. And I sort of learned the power of this sometime in the last year or so when I was on call in the ICU and there was a cardiac arrest in the general medical ward. And I was there helping to resuscitate the patient. And then who comes in? But Irene comes in. She's got her small ultrasound machine with her. She asks if she can be of assistance. And sure enough, as we do a switch over and people doing CPR, in a blink of an eye, she's got the ultrasound on the heart, the lungs, the abdomen, and she turns around and gives us information, which then helps us advance our resuscitative efforts. So not only impressive academic work, but translating it into clinical practice. So congratulations, Irene. Please come up and accept your award.
Thank you very much, Tom, for that. I wanted to thank the O'Brien Institute for this award, and I wanted to thank the Department of Medicine for the nomination. The one thing I'll say is that medical education is generally considered the poorer cousin of clinical research. Let me just say this, that in internal medicine, we're right now facing the biggest technological advance we've ever seen. And it's something, point of care ultrasound specifically, is something that fundamentally could change how we practice medicine at the bedside. So I'm really grateful for this recognition to allow me to do the work and lay the foundation for a successful implementation. So for that, I wanted to thank my learners, my patients, my colleagues at the Division of General Internal Medicine, my department, as well as the university, for the ability to do this work that I see no other colleagues in my sphere being able to do. So thank you so much for that.
Okay, so our next award is the 2022 Societal Impact Award, where we look at how does the research that our members do impact society. And this year's award winner is Dr. Lara Nixon. And I really think that Lara epitomizes sort of the Institute's aim to try and function at the interface of the university and society. Her work is focused on older people who've experienced homelessness. And I had the privilege this summer of getting to observe Lara as she interacted with Stephen Lucas, the Federal Deputy Minister of Health, and sort of explained to him and showed him how her work, thinking about social social factors that influence health, and how things like housing security, being part of a community, can both improve health and reduce healthcare utilization. So congratulations, Lara. Please come up and accept your award.
Thank you very much for this honor. I'm a woman of Scottish and Ukrainian descent and have been on this land against this since 1999. And I'm super grateful for the opportunities to learn and work together here. The work that we get to do has been supported by the O'Brien Institute since 2016 and the Brenda Stafford Center on Aging. We've really, that catalyst couldn't have been a more appropriate term. And more recently, we've had a lot of support from the Department of Family Medicine and Alberta Health Services, as well as community partners, the Aboriginal Standing Committee on Housing and Homelessness. And I really want to emphasize that I represent a whole team of people here who there's no way I could do this work in any way, shape, or form. We have representation from anthropology and sociology and family medicine and community health. And we've been able to forge a partnership with people with lived and living experience of homelessness, older adults who have not been able to secure housing elsewhere in our community. And we have a specific group, core group right now called The Exchange. And they were integral, along with Dr. Mulaney and Megan Sampson and others, in this nomination, which I was just gobsmacked to be offered and just to be nominated. So we're really excited about the next phase of work. We've just finished up a Health Canada project 3 years, and we have lots of learning to share. And we're really excited to do that with our citizen advisors. And thank you.
Okay, and our last award is the 2022 Lynn McIntyre Outstanding Service Award. And this is to recognize members of our community who volunteer for the Institute. And this year's award winner is Dr. Ron Segal. Ron is a general internist who I've learned since becoming Institute Director quietly gives. I mentioned earlier that internal peer review is really one of the key services we provide as an institute. And because we think it's so important, we sort of try and solicit really good reviewers. And every time we ask Ron, he says yes. And he always gives an outstanding review. As an illustration, this past year, he did 3 times as many reviews as the next institute member. And so we owe a great deal to Ron. Unfortunately, Ron, I'm pretty sure I'm looking here, said he couldn't make it because of clinical commitments. And so I asked maybe that we give a round of applause for Ron and for his. Okay, so maybe what I can do is, I know we've done lots of clapping, but I'm going to ask for one more round just to sort of, for the nominators, the nominees, and the winners of our awards for really the dedication and excellence they illustrate. So maybe one last round of applause. I want to just sort of finish off by asking you to please share your successes with the Institute. Either email myself, the directors, or the Institute. It allows us to then try and basically publicize them and helps us with our knowledge exchange activities. Next year, please nominate colleagues. I do think the awards are important. You know, once we get to a certain stage of life, we don't get that many ribbons. And this is a way to recognize the work of our colleagues. They also serve as important stepping stones for national and international awards. I see Fiona's in the back row there who co-chairs, you know, the Cummings School of Medicine's awards committee. And awards like this really do help us to then be able to put people forward nationally and internationally, which opens doors for them in their work. And finally, what I'd like to do is just sort of thank you for everything that you do to advance public health through research excellence. And I hope you have a great day. Pass it back to Aline.
Next up is Dr. Karen Benzies, a serial academic entrepreneur, a nurse and midwife. She holds a PhD and 2 postdocs from Stockholm and Ottawa, and has previously served as Calgary's Faculty of Nursing's Associate Dean in Research and Acting Dean. Karen has earned over $33 million in operating grants, led multiple large teams to generate over 140 academic publications. Karen's expertise and wisdom in design and sustainment of interventions in complex ecosystems and social innovation shaped her startup, Liminality Innovations, Inc. Karen.
It's just amazing to see how this sort of day, this week, our collaborations have grown and blossomed into this tremendous opportunity to think about social innovation at the University of Calgary. So we really appreciate the opportunity to speak with you today about defining social innovation for post-secondary educational institutions. So I would like to acknowledge our team that we've worked together, and I think maybe, Katrina, we can help you define health equity, because we've got a good process going here. So let's share, because that's what we do at the University of Calgary. By the end of our time today, you'll be able to describe the need for a definition of social innovation for post-secondary educational institutions, describe the method that we used which is a concept analysis that uses a literature review to really use evidence to define a concept. And then I want to spend as much time as possible getting feedback from you on the penultimate draft of this definition of the concept of social innovation for the University of Calgary. So knowledge of things and knowledge of the words for them grow together. You can hardly know the thing. If you do not know the words, you can hardly know the thing. And in other words, and many people have heard me say this over and over again, if we can't define social innovation, we can't measure it. If we can't measure it, how do we know we got any better? And so with our increasing call for accountability at post-secondary institutions, we undertook, with Aline's help and many others, the definition of social innovation at the University of Calgary. Prior to starting our concept analysis, we conducted a preliminary search just to see which disciplines across the university were publishing in the field of social innovation. My mandate is cross university, so all disciplines, all faculties, all institutes. And we really were just curious to find out, okay, who is publishing in the area of social innovation? As you can see here, business and management and social sciences contributed each about a quarter to publications in social innovation. Economics contributed nearly 15%. And very curious to me, medicine contributed only 5%. And yet I know from my work as a health services researcher, doing interventions for families of young children, that in medicine and other sort of nursing, those areas, we do a lot around social innovation and social impact. So it was very curious to me to learn that. And so then we undertook our concept analysis. We conducted a concept analysis according to Walker and Avant. And there's multiple components to this concept analysis. Today, I'll share with you only the definition and the attributes of social innovation. We started with an academic librarian who searched for multidisciplinary databases for us. We used Covidence to screen the titles and abstracts and full texts. Then we extracted the definitions to Airtable. Then the most fun, and it's a good thing I like working with children and families because I get to use my scissors and cut things up and color things. So we deconstructed the definitions and then coded them using Eichler and Swartz's 5 elements. Then we held 2 synthesis meetings with our multidisciplinary team to rebuild a definition relevant to social innovation in post-secondary educational institutions. Over Christmas, last year, seems like forever ago, 2 screeners screened 1,830 titles and abstracts. We assessed 757 records for eligibility, and our concept analysis included 272 records with a definition. We included the records if they were published in English, if they were literature reviews or conceptual papers, if they described innovation or social innovation, and were relevant to a post-secondary educational institution. We didn't impose any time limits on this, and we actually included Schumpeter's 1909 definition in our work. Records were excluded if they were primary studies, editorials, opinion papers, dissertations, or theses, or if they focused exclusively on business, industry, and community without mention of post-secondary educational institutions. So this is a little bit more about the coding scheme. So Eichler and Schwartz, in their systematic review of 222 definitions of social innovation, identified 5 elements. In those 222 definitions, 84% identified a social need. 73% identified some sort of innovative element. 61% identified implementation and execution. And about half each identified improvement, some sort of improvement, and 51% identified relationships and collaborations. What we then did, and that's my coffee table, we deconstructed each one of these 272 definitions by segmenting the words, then coding according to these elements. So I'll provide some examples of the coding process. So this is how we coded Antaze's and Wesley's 2010 definition. According to Eichler and Schwartz, this definition is missing the idea that social innovation addresses a social need. The Stanford Center definition includes 3 of the 5 elements and is missing execution and collaborative relationships. Benny Worth is from the Netherlands, and Jorge Cunha, is from Portugal, and I met him in Halifax last month. They included 4 of the 5 elements, but like Antaze and Wesley, they didn't explicitly state that the purpose was to address a social need. The Organization for Economic Cooperation and Development, or OECD, included all 5 of Eichler's elements in their definition. Now I'm going to move on to the attributes of social innovation that we gleaned from the literature. So from our analysis, we found that social innovation is a very broad and inclusive term. We believe that social innovation is a phenomenon that can be measured, and it must be driven by meaningful understanding of social need. It must be driven by discovery rather than exploitation, and the value should accrue primarily to society rather than to individuals. Social innovation must actively engage community with meaningful partnerships. And for post-secondary educational institutions, social innovation must balance service with intellectual productivity. Because of our experience, we also looked for gaps in previous definitions. Given the multitude of social innovation initiatives being undertaken at post-secondaries across Canada, we believe that intentionality is an element that should be included in the definition. While research relationships and collaborations were included in previous definitions, the idea of community engagement for collaborative action is particularly relevant for post-secondaries, where often we're thought of as the ivory tower and disconnected from our communities. So, on behalf of our team, I humbly present the penultimate draft of a definition of social innovation and invite your feedback. From our concept analysis, we suggest that for post-secondary educational institutions, social innovation is the intentional implementation of a complex initiative to address a social need that is enabled through collaborative action, leading to new or improved relationships and capabilities that are more effective, efficient, just, and sustainable. So please add your feedback to the chat. This will end the formal part of the presentation. Now, please, we're looking for your feedback on this. So put your feedback in the chat. We've got people monitoring. Raise your virtual hand to speak, or raise your real hand and someone will run a mic over to you so that the people on the Zoom call can hear. So I see real hands. Katrina.
Thanks, Karen. Your slide on the gap analysis, you mentioned intentionality and I think community collaborations. I think it's one slide back. I'm curious, community engagement. I'm curious how you landed on those two in your gap analysis.
It was multiple iterative reads of the 272 definitions, and they're all in Airtable. So we were able, well, what we did is we printed them off, and then I cut them. I color coded the words, and then I cut them into bits, and then I rebuilt them. And so where the literature talked about social innovation, they talked about social innovation as something organic and that morphed over a long period of time that resulted in a change. And I'm always in a hurry. And I think from the literature that whole idea of an organic change associated with social innovation isn't going to suit us, and it's not going to suit our funders who are looking for accountability and return on investment and impact with society. So this idea is that we have to plan, and I think the university has intentionally planned first with the Social Innovation Task Force, then with assigning some leadership and resources to social innovation. So I think we've already been intentional. What we heard a lot in the literature, what we saw is, and Jorge Cunha has done research on this in Portugal. In Portugal, only about half of any sort of social innovation actually involves a community partner. And I've been working with people like Carleen Donnelly for over 20 years now. And I know that community partners, if you listen to the nurses, if you listen to the physicians, if you listen to who's leading in the community, they know what they need. And if you listen to them, you'll get it right. And so this idea of a meaningful community engagement, I didn't know I was doing community-based research when I started out here. And so this piece, I think, is really critically important. And when I was Associate Dean Research, I would counsel all the new hires, all the new assistant professors. I'd just say, get in your car, because that's how you're going to learn. And so to break down that barrier, that ivory tower concept that we have, I think that was partly experiential, but the intentionality came directly from the literature.
Great. Thank you so much. I guess I should take this off. There we go. I feel it's a little bit risky to ask about the definition, but I would love to. So I'm Zach Marshall. Great to meet you from a personal distance. I'm curious about the use of the term complex initiative. I'm like, does it have to be a complex initiative? I feel like it's a complex social need. But anyway, that's my question.
Yeah, thanks, Zach. That's great and awesome to see you in person. So there's lots of great things that you're doing in social innovation. I'm so impressed. I presented this in Halifax at the International Social Innovation Research Conference, where we had social innovation experts from all over the world. And this was the definition we presented there as well. We didn't want to sort of change it before we had all the feedback. So they got stuck on complex initiative. And the argument in the room was, well, if it's not complex, if it were simple, everyone would have already figured it out and they'd already been doing it. And so that's one thing that we think is going to have to change here, but they picked that up in internationally. And so what do you think? Is it a complex social need? Or I think we're leaning to complex social need as the change. But it can be fairly simple. But the argument contrary was that if it were simple, everybody would already be doing it. The problem is it's complex, but I think it's the need that's complex, Zach.
Yeah, I totally agree. Totally agree around the complexity of the need, because it could be a simple quote unquote solution, but then there could be various barriers, which I know many of us do work on implementation as well. So, yep. Oh, that I feel better. Okay, thank you, because I was afraid to raise it.
No. This is what I was really expecting tomatoes in Halifax. And it just, no, they thought it was, that someone had undertaken this and the magnitude of the work. Like University of Calgary is kind of getting on the map in social innovation now internationally. So yeah, so please, any feedback?
So I have a question and a suggestion. So the question is, I wonder if the power differential between universities and communities needs to be addressed more directly, i.e. shared decision-making, engage before deciding on research.
Thank you. And thank you. I'm sorry, I can't see your face but thank you for that question. So yes, and that was our caution from some colleagues in Halifax, was that we didn't want to perpetuate that differential. What we've done here at the University of Calgary, pilot tested something I call reverse engineered community engagement. So typically, what we heard from the executive directors, or when I first started this position, was that university faculty would come to them, they need a letter of support for their SHRC or HR grant, that then, or they needed data. And then the researcher would disappear. The agency didn't know what happened, if the researcher was successful with the grant, if they actually conducted the grant, if there was any recommendations that the agency could use. So I said, all right, let's reverse engineer this because it's not working. It's a very traditional model. So with Tara and Amy in May and community partners through the Social Policy Collaborative, which is a grouping of about 18 agencies downtown, they put 3 complex social problems on the table to the university And instead of us going to them, they brought their problem to us, and we wrapped as much resource around them as we could. And sometimes it was just as simple as finding a postdoc who had experience merging StatCan data sets and then helping them write a report because they didn't have that capacity. The other piece is the agencies are realizing they need more capacity for policy work, you know, to create the more sophisticated data analysis so that they can actually make arguments to government and other funders so that they can make the changes that are sticky, that are really going to help people. So this reverse engineered community engagement, the community is very excited about it. We think we're going to try it again, but sometime after Social Innovation Week is over. But it's really created a lot of buzz in the community that we're willing to do this. There's a hand over there. We're just waiting for one more real hand.
Thank you. So I'm wondering if, considering your audience, there may be potential to include evidence and rigor in this, to speak to the process that has come to enabling such a nice definition, but then also to speaking to the fact that it's evidence-based and our implementation is based on science, and you know, it's a rigorous process that has enabled the collaboration.
Rigor. So I think could you reword that, please? I just pretend I'm a doctoral student and I need you to reword the question in my final oral.
Sure.
Say again.
So quite often there's a little bit of a disconnect. And so you spoke to the ivory tower, the disconnect between academia and maybe the applied research. And so in social sciences, we speak to rigor in our methodology. And certainly you've done that with the coding and cutting and pasting and clipping and all of that. And so I think that needs to come through, considering the audience is speaking to an educational institution and we base our practices on evidence.
And that was why I said, this is how we need to do this. That is why. And we started off with one method for concept analysis. It was too subjective. So we went back to the old Walker and Avant, which is very prescriptive, very rigorous, very well known. And because we need to speak across disciplines, that we need this kind of evidence to be able to say, look, this is what we need. So thank you. And maybe what you're saying is maybe we need to highlight the rigor of our process a bit more.
Sorry, if you're evaluating, where you've been and where you're going, and then there's certain accountabilities to funders and to the people, I think that needs to be included.
Yeah, and I'm watching Jamie for time here. And so the other thing that I wanted to point out, and that I think that perhaps post-secondaries across Canada, perhaps not the US as much, but post-secondaries across Canada may find this definition useful. But in terms of connectedness with the community, the University of Calgary is actually very connected with community. It's rare for the big universities across the country to be as connected with community as we are in Calgary. And so we've been in a lot of places across the country, and people are, number one, surprised at what we can do here because we help each other and we collaborate and we talk to each other. And so I think that connection with community here is stronger than many other large institutions in the country. And I can talk to you a lot more about that if you are interested. Okay, we'll truncate it and then people can email. They can email if they want answers, because I don't want to be late. Oh, do we? Okay. I just wanted to make sure that people knew who was doing this work, not just me. Yeah.
So this is from Jennifer Jackson. This definition is amazing. Thank you for this work. I could offer an in partnership or something that indicates an effort to do with rather than do for. So that was part one. And then she added, appreciate the reference to complexity, places the discussion in the literature with complex intervention implementation.
Thanks, Jennifer. Great comments.
Thanks, Angie. Great work, Karen. Can I ask, how do you envision measuring this? And so I think about it like if we have social innovation as part of our strategic plan and we're trying to track and measure our progress, and I recognize I'm a qualitative researcher who thinks in a very linear way, but I wonder a little bit about how we measure this.
Yeah. And so thanks for that question about how do we measure it. So my brain works in program logic models, the Canadian Academy of Health Sciences, based on work with the Research Excellence Framework in the US, we need to be accountable. So we need to look at, the whole process. How do we get from inputs and activities to outputs, to outcomes, and to impact? And the great thing about that meeting all of the international players in Halifax is they all want to help us to get better. And Jorge Cunha from Portugal is building an impact measurement framework. They're not quite done yet, but as soon as they're finished, they'll send it to us. And so it's impact, and it's very hard to measure. It's likely going to be stories partially, but it's going to need big data as well, because we need big data to show change in societal health and well-being. So all of those things. So this is sort of the mischief that we're up to next. That, and we need a bit of a governance model to figure out how this should work with community. Yeah, and so yes, they want to help us, Tom.
So this is from Penny Morelli. Could we not adopt this at an organization like AHS as well? It seems to capture our planning work.
Absolutely, and that's why Tracy Wasiluk is up next. And so that whole innovation pipeline and with community learning health systems, I'm not going to say much more because she's got a great presentation about how to really make this work. And one of our projects went right through their AHS innovation pipeline and has now ongoing funding. So I'll let Tracy speak to that, but yes, I think so.
From John Conley, how do we adjust for co-founding in complex social innovations?
How do we adjust for confounding? I honestly, if you have a big enough data set, you can put in a lot of covariates, but I honestly think that we need to assume that the work will be population-based and that I don't think at that impact level that we're going to be able to, John. But if you've got some ideas, I'd sure love to talk to you.
Okay, I'll just keep going here. Oh, do we have time for one more maybe? Okay. So this is from Randeep Dhaliwal. Dr. Benzies, I'm curious about the barriers to social innovation. What are some of the concerns in the literature about why social innovation isn't adopted? How can we address some of those barriers?
So again, that leads nicely into Tracy's talk, because typically when we think about research, and Randeep is one of my amazing doctoral students right now. When we think about research, usually what happens is you've got there, it's delineated by the end of the project, by the grant, by the funding. But if you truly are going to have that impact on society, you have to think much bigger than that, Randeep. So your program of research that I talked about, you need to think about how the pieces fit together so that you get to the end point of impact. And so the Alberta has a process. We've got a mechanism. We've got a way now that's been demonstrated. It works. It will go end to end, from great ideas or concerns from community about their pressing social needs, right through to ongoing funding for the work. So we have to just think bigger. We have to not think CIHR to CIHR grant. We have to think much bigger.
And Karen's already nicely segued to Tracy. Next up is Tracy Wasiluk, the Chief Program Officer for the Strategic Clinical Networks and Alberta Health Services. She is a seasoned AHS executive, an adjunct professor, and the co-lead for the Alberta SPORE 2.0 health learning system. She is a celebrated leader and innovator who has won many prestigious awards from the Canadian Nursing Association and AHS, recognizing her contributions to innovation and quality improvement in real live health systems. We will watch a pre-recorded video and then she will take questions by Zoom.
Good morning, and thank you for this opportunity by the O'Brien Institute to present to you today around the Alberta Health Services Innovation Pipeline and how social innovation is supported in the AHS context. I think Dr. Benzies really set the stage for talking about social innovation, and I hope to carry those concepts from not from a post-secondary education perspective, but more from a health system perspective. My objectives today are described with the learning health system in AHS, give you a bit of an overview of the SCNs as one of the assets that leads to learning health system work in our province, talk a little bit about the innovation pipeline and how it contributes to learning health systems, and follow up with two specific examples around how the innovation pipeline has allowed us to drive a learning health system and really speaks to how social innovation is happening in our province. I have no disclosures and no conflicts to disclose. So based on the discussion earlier with Dr. Benzies, one could imagine that a learning health system is a form of a social innovation. And today I hope to speak to you about this, thinking around social innovation, how it's actualized in Alberta's health learning system. But first, just a little bit of a definition. The Institute of Medicine speaks to learning health systems as a system in which science, informatics, incentives, and culture are aligned for continuous improvement and innovation, with best practices seemingly embedded in the delivery process, and how new knowledge is captured as an integral byproduct of the delivery experience. So one of the fabulous opportunities here in Alberta is our unique assets that have developed well over time. We are a single health authority. We have organized communities of practice called SCNs and provincial programs. We have new governance or ongoing governance with primary care networks and zone connectivity to help us shape the primary care environment. And their recent modernization of Alberta's primary care system is just one more evolution in that opportunity. We have integrated data-rich information systems supporting health and social care innovation. And as many of you know, we are midway into the full implementation of a provincial electronic medical record called Connect Care. And finally, we have strong capacity and relationships with universities and research centers to really evaluate value across the system. I think one important thing to think about in Alberta is that we have been the first to become a single health authority and the first to really start to operationalize what value-based healthcare is at provincial scale. And as many of you have either lived or are aware of, design, implementation, and evaluation of effective multi-component interventions typically takes decades before value is realized, even when value can be measured. So value-based healthcare is an approach to improve patient and health system outcomes, is a way of organizing our health systems to transform outcomes and achieve the highest quality of care with the best possible outcome at the lowest cost. And value-based healthcare is about linking how much money is spent on healthcare programs or services over a patient's journey to the outcomes that matter most to patients, rather than just focusing primarily on the numbers of services or specific processes or products. Value-based healthcare endeavors to achieve the highest quality of care and the best possible outcomes with the lowest cost. And in Alberta, the pursuit of greater value in healthcare is intrinsically embedded within its integrated learning health system to optimize outcomes and achieve the quadruple aim. The overarching goals of a learning health system endeavor is to increase the value of healthcare in alignment with the quadruple aim. And as you know, the quadruple aim is a vision for healthcare in which we work to improve healthcare's value for money by improving patient, caregiver, and provider experiences with healthcare and improving patient healthcare outcomes. A learning health system can be thought of as a dynamic ecosystem of change, enabling learning through a strategically designed infrastructure and approach that includes iterative data to advance the knowledge to practice cycle, supported by infrastructure, systems, and resources that provide foundational supports for an LSH. Social science, technology, policy, legal, and ethical supports are considered pillars critical to a learning health system because they provide the organizational priorities, policies, and funding sources needed to accelerate learning. Core values of a learning health system include adaptability, participatory leadership, equity, inclusiveness, open innovation, integrity, shared accountability, solidarity, and transparency. And these are all important underpinnings, and LHS reflects in the ingredients needed to move from a reactive to a proactive health system where a learning improvement culture is embedded across the system and really can take action to address challenges and capitalize on opportunities. Structures and accelerators to support Alberta's learning health system have evolved over time with empirical evidence of their ability to impact population outcomes. Key to this evolution over time has been the SCNs, or the strategic clinical networks. In existence since 2012, SCNs reflect the goals, processes, pillars, and values of a learning health system. The SCNs were built on multidisciplinary partnerships, including patients, family, the public, and policymakers, designed to identify gaps in patient care and outcomes and move evidence into practice. And this slide illustrates today's 11 SCNs and the 5 integrated programs. And the SCNs are really a fundamental infrastructure and mechanism for driving innovation and improvement across Alberta's health system. So what do SCNs do? Well, they do several things, but one major goal is to continuously measure health status and performance of our healthcare and social support system, identify gaps in care, work with patients, policymakers, frontline clinicians to prioritize the most important gaps, align those with the priorities of both the funder and the delivery arm, AHS, and tackle system-wide needs and priorities to solve health problems relevant to individual Albertans, populations, and the entire health system. We use evidence to inform actions and develop innovation solutions to overcome these gaps, evaluate their impact, partner with operations and those that deliver daily care to implement practice changes. And in doing so, the ultimate goal is to improve care, health outcomes, and value for the people of Alberta. Embedded capability within each SCN and provincial program are the scientific offices. The SCNs and their scientific offices rigorously monitor data, evidence, and emerging research from Alberta and health systems around the world. They bring leading practices, tools, technologies, and innovations to our province, evaluate them with a local context, and think about spread and scale of those proven to improve health value and quality. So each scientific office, well, a very small team, constituted of a scientific director and an assistant scientific director, are real powerhouses and engines of innovation that are helping propel Alberta's health system forward, improving outcomes, value, and performance. And in some of the provincial programs, their scientific offices vary in their structure and size. Some have split this functionality across multiple groups. For example, in some cases, scientific teams are embedded within integrated provincial programs, and they bring those capabilities to the newly informed program areas noted as provincial knowledge, evidence, and innovation divisions as part of clinical centers of excellence, and work closely with their provincial program directors, health informatics teams, and others to support program evaluation, quality improvement, innovation, and health system transformation on a provincial scale. So while they're not identical, the functionalities that we expect from an SCN and a provincial program are all embedded. So focusing research on health system needs is a really critically important transition from trying to get health systems to integrate academic effort with the needs of Alberta's health system. And one of the things that is a benefit here is by not trying to fit a solution to a problem, rather identify a problem and then engage the research community to build capacity to develop and test these potential solutions within clinical settings so that we can determine if they can be implemented broadly. This approach around pulling research into the system based on health system needs really supports rapid translation of knowledge and evidence into practice. And it really helps us to embed an integrated knowledge translation plan right from the get-go. Funding agencies like CIHR and others value this integrative approach, and more often are asking to see this kind of integration in grant proposals in order to be rewarded. And in Alberta, we've been very successful because of that integrated approach. I also wanted to point out that in our relationship with the academic institutions and our desire to improve the relationship with our partners, we've developed scientific director liaison positions, and Dr. Nish Panu and Dr. Eddie Lang help us to create that push-pull between the universities and the networks, both for U of A and U of C. And their role really is to facilitate communication, awareness, and opportunities for cross-disciplinary collaboration. Operationalized through the SCNs and Alberta Health Services Health Evidence and Innovation Program, we have over the last 12 years developed an innovation pipeline, which provides the structure to guide the design, deployment, and evaluation of innovation across the health system. The innovation pipeline is a defined process SCNs use to translate evidence into care by enabling rapid, rigorous, and efficient evaluation and implementation. It is built on the principles of quality, safety, and the use of best research to help patients, healthcare providers, and the healthcare system work at its best. It is an intentional strategy aligned with the quadruple aim and outcomes of a learning health system, and it really acts as an important accelerator of evidence-based intervention. The innovation pipeline has transparent and predictable structures and processes that accelerate application of evidence to adoption. The structures and processes are driven by change management, patient and family-centered care, and implementation science frameworks. Critical to the process is a carefully laddered series of funding opportunities to finance the 5 steps of adoption of new evidence. And the SCNs are the embedded structures that form the starting point of adjudication of high-value priority initiatives. AHS has underlined the importance of generating evidence to demonstrate value by 1, aligning partnered funding opportunities with the pipeline, 2, ensuring that evidence demonstrating value determines the effective prioritization, allocation, and management of resources, so that when a really good potential project is ready to scale, the data and evidence required by the decision-making functions within AHS are established and can be justified to that group. I just wanted to outline that a lot of this work can start with the SCN transformational roadmaps that outline the priority pillars of work for each of those areas. And the scientific offices have been a significant contributor to early career capacity building and sponsoring both studentships and seed grants to look at innovation of value. And at this stage of the pipeline, our goal is to make investments to pilot innovation, and if successful, fuel future granting opportunities. But it's also at this stage that if the opportunity is not worthwhile, that we learn how to fail fast. And I just want to say that in fiscal 2021, over $350,000 was awarded to both studentships and seed grants across the SCN. So making really good contributions to that effect. I'll just go back. There are 2 other funding sources that I want to talk a little bit about that really have been enablers, both PRIUS and HIS. The Partnership for Research and Innovation in the Health System, often called PRIUS, serves as a funding enabler for step 3 of the innovation pipeline and focuses on addressing health system challenges by testing the implementation of solutions that are supported by strong evidence of clinical effectiveness and have potential to deliver significant, measurable impact of health system performance. And the goal of PRIUS is to support the pull of innovation into the system, to rigorously test and build the necessary evidence to make value-based funding decisions for sustainability. The HIS Fund, also known as the Health Innovation, Implementation and Spread Fund, serves as a funding enabler for step 4 of the innovation pipeline, focusing on spreading innovations that have been implemented in the healthcare system and demonstrate significant value for both the health system and for Albertans. HIS aims to ensure that the gains are maintained while successful solutions are spread to the full scope of the healthcare system. So they really bridge the gap between spreading and scaling across our system. So this slide really illustrates how these concepts fit together and what I would call a complex social innovation. The mechanisms of how the SCNs and the provincial programs use a learning health system to actualize the innovation pipeline are illustrated in this slide. And this is how it all fits together. The idea of a learning health system using the pipeline, using the inputs of where gaps in care, patient and family-centered opportunities are to drive innovation, to improve the quadruple aim, underpinned with the pillars that I spoke about, really lead to a very sophisticated mechanism for ensuring that proven innovation can spread into the health system, and it can do it in the examples that I'm going to talk about today. They can do it within 5 years. So the first example I'd like to offer is the Enhanced Recovery After Surgery project. So enhanced recovery after surgery is really about implementing evidence-based guidelines and protocols across the entire continuum of surgery. And the clinical evidence in the form of what are considered internationally developed and adjudicated evidence-based guidelines that were started in the United Kingdom and the Netherlands were brought over to Alberta through the Diabetes, Obesity, and Nutrition and Surgery SCNs. And AHS implemented the Enhanced Recovery Surgery Guidelines. They started at 2 sites, they went to 4 more sites, and they spread to 9 sites, including 3 major teaching hospitals in 9 different program areas, from orthopedics to breast cancer surgery. And the process of using the innovation pipeline allowed us to look at it from an initial pilot demonstration project for colorectal cancer to the spread and scale to major hospitals across Alberta. The international guidelines really use an approach of best practice and multifaceted data and local multidisciplinary teams to improve care and outcomes across the preoperative, intraoperative, and postoperative period. You can see there's several different care elements that are listed here. Things like pre-op education, modern fasting guidelines, carbohydrate loading, anesthesia and postoperative analgesic techniques, and early postoperative feeding and mobilization practices. And after the first 5 years, I think some of the key outcomes that are summarized in this slide. So together with these practices, when implemented with fidelity and compliance, contributed to accelerated recovery, reduced complications, shorter lengths of stay, decreased readmission rates, enhanced patient and provider experience, all of which contribute to the significant value in the quadruple aim goals. And the funding provided through Alberta Innovates and the AHS with the Prius grant really helped us accelerate the opportunities to implement and evaluate ERAS in Alberta's integrated health system. In addition to the clinical and system improvements noted, a cost-effective and economic evaluation was completed for this work, and it demonstrated health system savings amounting to more than $10 million over 5 years. And at the end of their analysis, they concluded that for every dollar invested in enhanced recovery after surgery protocols, there was a $2.35 saving to the system. And with this kind of evidence, the networks were able to build a strong business case with clear and compelling Alberta data to request operational funding to spread and scale this innovation broadly across the health system. And I am happy to say that we were able to secure additional operational funding in order to complete that spread and scale. And one of the data points or abilities that we have developed through the pipeline is this idea of benefits realization and the production of a benefits realization calculator. And the benefits realization approach enables innovative teams to demonstrate to healthcare funders and decision makers that their proposed solutions have the potential to make organization or broader health system measurably better, and that the investment that is being asked for to spread and scale an innovation that's required to make it stick at scale is likely to be worth it in relation to the value of the improvement they expect to create. So using the benefits realization approach, site-specific improvement forecasts were prepared for all the sites, and actual improvement results were monitored to demonstrate that value was being created as planned. And this kind of calculator capability has really helped build out part of the value-based healthcare strategy that AHS has endorsed, and really is embedded in our innovation pipeline, so that as we move innovation along the pipeline, we're generating the evidence needed to inform future funding decisions and to help managers and decision makers demonstrate that the value invested is achieving the results. So the scale of ERS implementation across the province would not have been possible without an integrated learning health system approach and the availability of the local data to drive the improvements, to mobilize data and knowledge that contributed to building the compelling case for implementation, and for building the value proposition that was created across our system. The SCNs provided essential social capital and scientific infrastructure for this to happen. The dedicated funding from PRIUS and the innovation pipelines clear pathway provided essential policy and scientific accelerators to advance this initiative. And I'm happy to say that we are still scaling the ERS pathways more broadly for all surgery, not just those with international guidelines. And this has been nicely connected with our work around the acute care bundle improvement that's going on in AHS today. Second project that I just wanted to illustrate is the Alberta integrated, Alberta's FICARE, Family Integrated Care Project. And this is a very busy slide, you can't see it, but this maps out all of the steps that FICARE took to be able to understand the issues related to Alberta's preterm birth rate, and the problem that we had in Alberta as being one of the highest with a preterm rate. Consulting with experts in Ontario who had started to look at a model for family integrated care, and then applying for a PRIUS grant to complete a clinical effectiveness, a cluster randomized controlled trial to be able to demonstrate the effectiveness of FICARE in Alberta. So Alberta FICARE is the next generation of family-centered care for NICUs, or neonatal intensive care units, that provide care for critically ill and preterm newborns. The trial was really successful and able to allow us to build practical tools and strategies to operationalize the model. And through FICARE, it demonstrated efficacy for parents, babies, and the health system. The results of the CRCT showed that with Alberta FICARE, mothers and fathers were less stressed, more confident with their infant when they were ready for discharge. Infants in the Alberta FICARE group had a shorter duration of parenteral nutrition. They had shorter time to full enteral feeding than infants in standard care. They were discharged 2.5 days sooner, and they did not have more emergency department visits or readmissions than infants in the standard care group. So these illustrate some of the great improvements that were seen when through the Prius grant. And because of these positive results, the team actually applied for and was successful in receiving HIS funds to scale and spread the innovation across the 14 NICUs in the province. And they were able to successfully do this over the entire COVID pandemic. And it just speaks to the commitment and the processes that the team used to continue to support and engage clinicians in this work. Obviously, with the support of AHS Analytics and the whole project team, the FICARE group were able to develop a Tableau dashboard with near to real-time administrative data, continually monitor the key outcomes, length of stay, ED visits, and readmissions. So from a learning health system perspective, it's that data to knowledge, knowledge to practice, and then making adaptations based on that close to real-time data. And then the AHS benefits realization team were also used to develop what we called the improvement calculator. And this is a bit more of an improvement over the work that we did at ERAS, because ERAS was our first calculator. But this really looked at measurement of value month over month with a view to give positive feedback to managers and decision makers as to how the improvements were tracking, but also to look at the return on investment of the initiative. Because the improvement calculator compares current data like length of stay for each of the NICUs, and they take the data from the dashboard to the expected length of stay, and they're able to estimate the site's performance both prior to and after the implementation of the Alberta FICARE model. The improvement calculator shows that the initiative has realized a positive return on investment, already creating over $1.1 million in value for Alberta's health system, and more importantly, freeing up costly NICU capacity through a length of stay reductions. The other thing that was really critical was to demonstrate that the intervention did not adversely impact quality. The improvement calculator does help us with that by incorporating balancing measures. So 7-day emergency department visit and 7-day readmissions, and similarly compares them to expected levels based on pre-project performance. So as the initiative transitions from scale and spread to sustainment, the impact estimates and the ROI calculations generated by the calculator actually supported a business case for ongoing operational funding using the near real-time data. And so it really helped us to build in all of the elements to sustain the practices. So typically, when you think that healthcare decision makers must choose between quality and cost, with Alberta's FICARE, AHS received higher quality at lower cost. So it was an easy operational decision to make. So moving into innovation into practice requires health systems to think about their assets and how they can be best organized as a learning health system to advance their ability to improve value-based decisions that improve the quality of care and the quadruple aim, and really to shape this shift in thinking, leadership, infrastructure, and deliberate mechanisms like an innovation pipeline, coupled with strong networks of practice and research, can really facilitate this change. So I wanted to say thank you for this opportunity to share this great work that all my colleagues and our system has been engaged in over these last 12 years. Morning.
Okay. Thanks so much for your presentation, Tracy, and I guess just for sort of contextualizing learning health systems within Alberta. In your presentation, you kind of spoke to the importance of researching health system and patient needs in Alberta, the importance of sort of, advancing that quadruple aim and the patient experience and outcomes, and then that sort of shift towards CIHR and funders really emphasizing IKT and patient-oriented research. I'm just wondering how you think, or any suggestions you have for us as researchers to support patients and developing a role as social innovators themselves, and how they can kind of play a role within that pipeline and how we can help that.
Well, thank you for that question. It's a good one. I guess from my vantage point, so there's a couple of things in Alberta that we have. University of Calgary actually trains patients as patient and community engagement researchers. So we're actually building a bit of that in social innovation capacity and capability through the PACER program. But also, I think through SPORE, the patient engagement platform under Dr. Maria Santana, they have a wealth of and a very engaged group of individuals who want to be involved in both innovation and in research. And so part of, I think, our role as a researcher is to tap into those capabilities and have patients involved with your work right from the get-go. And because of those programs and that availability, there's no shortage of, like, you should be able to get patients involved right from the get-go. And my experience is that patients really do, they really do want to help drive the agenda, and they provide very valuable input and recommendations for any research protocol, and actually strengthen the proposal because of their lived experience. So that would be some of my recommendations, is to approach it that way and take advantage of what we have here in Alberta.
Absolutely. Thank you very much.
Thank you. There's a question in the text box from Jennifer, but I'm not sure, Jennifer, if I completely understood what you were. So I was wondering if you could ask the question for me.
Tracy, can we go to the question in the audience here, and then we'll
Sure.
get Jennifer to clarify, and then Brittany she actually uses the mic to repeat the question so everyone on Zoom can hear as well. So
perfect.
But we'll take the first question from the audience.
Thanks, Karen. Thank you, Tracy. I think it's really important to be able to show how to measure social innovation. And so I was really intrigued by your ROI graph there. Could you talk a little bit about how you came up with that formula? Is it just day saved, or? And I'm really curious about that dip that was in the curve too.
So would that be for the which benefits calculator? Were you thinking of the ERAS one or the FICARE example?
The FICARE.
Yeah. So in AHS, we have some very smart people who helped build the benefits realization strategy. And one of the focal points for the benefits calculator was to think about, instead of looking at multiple measures, picking one or two that measures that were of value and that you could actually monitor and measure over time. And so the notion was to be able to get a pre-implementation baseline, and then use the calculator to get the month over month improvement based on the changes that were being implemented. So in FICARE, it was the calculator was based on length of stay. And so that's what it showed over time, that our length of stay was improving, and that the benefits, there were between the benefit calculator and the balancing measures, there was not only was there sustained improvement, but there was no slippage or there wasn't unintended consequences as a result of implementing the new model. The dip that you saw, and Karen could probably tell you even more specifically what that dip was because she was the primary investigator, but I think that dip in time was around during COVID, and there was some challenges during COVID implementing the model because of the scarcity of resources and just what was going on in the system at that time, lots of redeployments. So that dip just reflected the current state of what was happening at the time. And you can see that it did substantially as COVID got better, as our health system got better, because COVID wasn't as bad, you saw the improvements increase again. And in some instances, we weren't even able to get into a few of the NICUs because the staff just didn't have the time to do the training. So hopefully I've answered your question.
Right on, Tracy. There were 2 COVID pauses in that project.
So an online question from Jennifer Jackson. I appreciate your point about using evidence. We have found that the current government doesn't always use evidence in its decision making. How do we navigate this / try to support patients when the evidence isn't politically popular, i.e. safe injection sites?
Yeah, that's a really good question. And I don't think there's any right answer. My experience with this is that you have to keep trying. I think our job is to try and generate the evidence, demonstrate value. If the uptake isn't there, sometimes you have to kind of go. Continue to write what you need to or produce the evidence as you can and publish it and get it out into the literature, even though a political party may not necessarily take up the evidence. I think we still have a responsibility to generate it and publish it and to try and inform policy as best we can, recognizing that political parties and the political cycle is about a 4-year cycle. Sometimes part of it is based on timing as well. And so, yeah, you kind of have to work within those realities, unfortunately. But I think getting the evidence, I think at least getting the evidence published and getting it into the literature is a really important step.
Thank you very much, Tracy, for a great presentation. Mike, I have a comment and question about the Strategic Advisory Group. So my plug right now for people here is that my understanding is that Alberta Health Services is running a search for co-chairs of the Strategic Advisory Group. My superficial understanding of it is that this is the group that over the pandemic provided rapid synthesis reviews for Alberta Health Services, of which as a clinician, I took advantage of. And it's now been rebranded, relaunched to look at sort of a broader host of issues. And for me, it seems like this might be a great opportunity for academics to participate and use their knowledge and serve as a vehicle between Alberta Health Services and academic organizations. My question is, I didn't see it anywhere in your figures around social innovation or the innovation pipeline. Do you think that this organization and their co-chairs plays any role in that process? Or could?
Yes, I didn't put it in because, Tom, thanks for the question. I actually didn't put it in because it hasn't quite formed. And you're right, when we created the scientific advisory group, it was really to do that rapid review and try and respond to the many questions that we were faced with during the pandemic. And what it really demonstrated was that the SEG group, we call them SEG, were able to do those rapid reviews and the synthesis and put that in the hands of decision makers and policymakers, both within AHS and within the government, and do so in close to real time. So the reason we're going to retain it is that we think it's a really important part of a learning health system to have that mechanism in place. And I can see SEG actually maybe influencing what maybe a couple of areas. They might be able to influence some of our priorities about how we would maybe run a Prius competition. Maybe they may help form some of the the boundaries as to what would be invested in. And with our HIS money, it is a joint relationship with Alberta Health, and priorities are established prior to the HIS fund competition. And so I could see SEG playing a role in, excuse me, I could see it playing a role in maybe establishing what some of those priorities are. And then the third area where I think it might influence is in areas where there are gaps. I can see those gaps being identified and sent to the particular provincial program or SCN to maybe think about studying. So it more of an influence role in terms of establishing priorities around the transformational roadmap. So again, it's early days, but I can see that being a really valuable resource for both the networks and the system. And I agree that it would be excellent to have more engagement. We had a lot of engagement with the academic community, and I think the strength of that relationship really bore out during COVID. And so to continue to foster those relationships, I think, is critical. The other thing, Tom, I might say is that Alberta Health is doing a review right now of the innovation capabilities in Alberta, and they're looking at where the gaps are and where opportunities for improvement could be. So that scientific advisory group may also have an influence on some of that work into the future.
Okay, so an online question from Karina Zhu. ERAS outcomes at 5 years, there were reported cost savings for care and reduced length of stay. What were the measures for patient and family experiences of the ERAS practice guidelines pre-operatively and post-operatively?
Thanks for that question. So the patient reported outcomes, there was a patient reported experience measure and a patient reported outcome measure. It wasn't done pre-operatively, it was done post-operatively because pre-operatively patients wouldn't have necessarily had, they wouldn't have been able to report an outcome other than they wanted to have their surgery. So those prems and proms were done post-operatively. And the other thing that in terms of, we had several patients who had had a surgery prior to ERAS guidelines, and then they had surgery, a similar surgery after the ERAS guidelines were implemented. So we had a couple of more anecdotal responses from patients speaking about how their post-operative journey was so much better using the guidelines versus prior to the surgery before. So that's how we measured it. The other thing that we tried to really get a handle on is when we implemented the guidelines, there was in the early project, patients kept a journal and they would journal their experience. And so we also got a lot of feedback through the journaling that patients did about, their post-operative experience that also contributed to those measures.
Last call for questions. Hearing none, I Tracy, thank you so much for presenting such a complex process, but such an effective process that we can use as scientists here in Alberta to actually make our research matter. So thank you very much, Tracy, for all your hard work over the years with this and your great talk today. Thanks.
All right. Everyone's back, refreshed, ready for our distinguished guest, Dr. Peter Milley, who is a professor in the Faculty of Education and Director of the Center for Research, Education, and Community Services at the University of Ottawa. Peter teaches and conducts research on topics related to educational leadership, administration, policy, and evaluation. His most recent work focuses on the leadership of social innovation initiatives in Canadian universities, as well as on inclusive and participatory methods for conducting applied research and evaluation in social innovation contexts. Prior to joining the university, Peter served for a decade as senior advisor in the Canadian Federal Public Service, providing guidance on their executive leadership development programs and on public administration reforms. He also served as director of research for an international network of senior public officials, academics, and experts focused on defining future directions for public administration and policy, where social innovation featured centrally as a path forward. Welcome, Peter.
I don't know who wrote that bio, but it's not mine, clearly. Thank you for having me here. I'm really delighted to be here, and it was really fantastic to be able to be an interloper and sit through the conversations you were having at the beginning of this session. It's really helped me better understand, to some extent, who you are as people in the O'Brien Institute. The O'Brien Institute I read about. I read the report, Tom. Very impressive. Very intimidating and terrific work. But one of the things I didn't expect to occur to me, honestly, is the dimensions to the work that you do, working in the fields that you work in this context. And didn't occur to me, obviously you're in the health field, so yes, you work in health. But I also, forgot that you also, many of you are educators. You're actually supervising students, you're supervising interns, you're supervising residents, whatever it is that you're doing. And then this made me think what COVID must have been like for you, because I work in education. We had to worry about teachers through COVID and students through COVID. You had to worry about patients, families, people you're teaching and helping to learn. And I just really wanted to thank you. I never realized how much work would be going on in your professions that was so multidimensional. I really wanted to thank you for the work that you did during that period. That probably went very unrecognized by many. So let me recognize you for that today, please. That's one thought that came to mind. The other is just how mad this topic of social innovation really is. And the debates that are going on in your community and are going on in other communities around what is social innovation wise and important. How do we do it? How does it emerge? How do we scale it? All kinds of different questions like that that are going on. So what I'm going to do today, Karen very kindly invited me, Karen and the team kindly invited me to present on some research that I've been doing in my work at the University of Ottawa and through the Center for Research on Educational and Community Services. The center is a research dedicated to social inclusion through research and through community engaged forms of teaching and learning and research. So that connects very closely, I think, with some key ideas that have come out today already. It's interdisciplinary. It crosses the Faculty of Education, the Faculty of Social Sciences, and we had numerous members who work in medicine and other health professions, including those working in health professions education. I myself feel like I say an interloper in your community because my background is more in educational administration, full stop, and not specifically in the health sector. But I hope that what I present today will stimulate discussion among you, it being slightly more general than the discussions you've had today about how to do innovation in the health sector or health professions sector. But that hope will raise questions about how to approach it, how to conceptualize it, how to work on it. So that's sort of the idea. And I've gone totally off script already, but that's perfectly fine. So there's the roadmap. So just really very brief background. We all come to social innovation in different ways and for different journeys. I'll just tell you very briefly about mine and why it was that I got excited about this idea. Then I'm going to go into 2 studies that were conducted. They're going a little stale. You know, they were published in 2020. I got then distracted by numerous things, but including a SHIRT grant from New Frontiers to try to start with colleagues at U of O, social enterprise focused on supporting work with people with cognitive disabilities. And so that kind of went on, but we're not ready to report on that, so I won't tell you about that quite yet. And anyways, and then some Q&A. I hope my presentation will take no more than 30 minutes. I don't want to take more than that. We've got great timekeepers in the front to keep me on track. So from the bio, you heard a little bit about me. I came to social innovation really through 3 kind of stages in a bit of circuitous career track. The first was early career, where I worked in the post-secondary education sector in jobs that brought me into close contact with community and industry. And so co-op education, continuing studies, community-based and contract-based research, managing those operations in various institutions. And I got very curious about this idea about how do we actually come together between industry, community, and post-secondary education? How do we cross those boundaries to lever our collective resources to achieve some greater aim than we could achieve if we just worked in our own little silos? So that was early on. Then I had this amazing experience to go work in the federal public service. I know federal public service can be a bit difficult in Alberta sometimes. Please, go with me here. But amazing experience there to do a variety of things. But one thing was this international project near the end of my time there, looking at the future of public administration, working with senior people in 6 different countries. And a core part of that came out of that discussion was social innovation, basically as a kind of new tool of public governance and a new tool of public policy. And then I've had the chance to move back into post-secondary education in my work at the University of Ottawa, and this thinking infused into this kind of research program that I've been trying to limp along with and pursue over the last few years. I just wanted to talk briefly about when I was working on that project in the federal government near the end. One project that came to mind that had a post-secondary flavor that I thought was really cool and really ignited my imagination was when the earthquake in Haiti took place back, the big earthquake in Haiti took place. There were 2 grad students at Tufts University who had been working on a GIS platform. It was an open source GIS platform that had been developed by a nonprofit group in Kenya to map election violence using cell phones. So live cell phone use mapped in real time on an open source GIS platform to report violence at the polling stations. And this platform, created by a nonprofit group, was made available freely and publicly on the internet. And so these students at Tufts were working on something with this platform. And the earthquake happened. And they immediately thought, hey, we have a platform. People in Haiti have cell phones. Let's see what we can do. And over the course of literally a few weeks, it became the official emergency response platform, including releasing of secure military satellites from the United States to help with the communications. The recruiting of a diaspora of Haitian people from within the Boston area to actually translate the calls coming in. So there's a lot more to that story than just that. But for me, that launched this kind of crazy sort of, how does that work? How does that work? How is the world working now when these things can happen? And Karen mentioned the issue of like organic versus intentional innovation. And this is where the quagmire comes for us, because this would appear to be pretty organic, intentional in the sense we want to do something with this, but pretty organic in terms of the unusual cast of characters that then leap into the fray here and create this sort of major kind of system of public value creation in very fast time. And then we also started talking about, this may resonate more in your area, but the Human Genome Project, and in particular, the pursuit of that work between public and private actors. And the genome being mapped as a private good versus the genome being mapped as a public good, and the amount of collaboration needed across boundaries and across sectors and from the academic community and other actors to have that success occur, and the amount of value of public good that's being created out of the public mapping of the genome. So that's open science as another kind of idea about social innovation. And then citizen science is another idea, which is where citizens are actually become the researchers, the co-producers of knowledge through open citizen science. So these are just some ideas that lit up for me at that time. And then coming back into the academic community or back into post-secondary education, there's some context and drivers that have already been mentioned today about why social innovation is important. The first one is that universities or post-secondary educational institutions and affiliated bodies, which in your case would include, I'm sure, your actors in hospitals and so forth, are being asked to create economic and social goods. Not just economic, but economic and social. And they're being asked to have both instrumental relationships, in other words, ones that are more transactional in basis, and in some cases, transformative relationships. In other words, it's our responsibility not to reproduce the existing class and social structures through our organizations or institutions that they've been reproducing, but we need to think through the transformative potential of what it is that we're doing inside and outside our institutions. And then there's opportunities in challenge. And the Alberta Health Services presentation was mind-blowing for me on that in terms of innovation policy and funding. But so there's opportunities that have been emerging to kind of seed and promote innovation, but innovation that has a focus on social impact, not just economic impact. And then the notion that our institutions themselves have been accused of being quite sclerotic, having grown out of medieval traditions, that they haven't really grown much further than that in terms of their elitism and their in-group sort of a way of going about things. So there's a variety of needs institutionally for adaptation and responsiveness that are being talked about in your community already. So these are some of the key kind of drivers. There certainly has been some empirical research going on, but although the knowledge base on social innovation, like Karen and colleagues' conceptualization talks about, goes back a century, the current era may look somewhat different than it did when Schumpeter was writing or Max Weber's writing on it, or right? The context is different. I think, Karen, you've hit on that by way of kind of the more instrumentalized context that maybe we're in now with accountability and measurement and so forth. But as well, the actors are slightly different. So the actual knowledge base of the current era in terms of empirical science or empirical studies on this is actually not all that robust currently. And so in my small way, I was trying to do something to kind of add a contribution at least and move this along. So this is where it's going to get tricky. And fantastic, because we've had a conversation today already about how do we conceptualize social innovation. The way I've been working with this in my research is to try to think about the ideas that are available in the literature as ideas to sensitize empirical research, but not necessarily to kind of deduce what it is you're looking at. It's rather to use them as a reflective base for what you actually come to see empirically. And then these ideas may begin to resonate, these conceptual ideas may begin to resonate into, some kind of more theoretical kind of orientation that can be brought to bear. That's the current way I've had to think about it, because honestly, to survive peer review in this area, you can't, generally speaking, come down on it because somebody's going to come back and say you haven't conceptualized social innovation properly, therefore reject you outright. So in a way, it's a bit of a tactical thing, but I actually think it's a scientific approach, at least a social scientific approach that I'm currently trying to work with. So like we said, it's a difficult conceptual field, and I really appreciate the work that Karen and colleagues and you're all doing here in your community to try to kind of noodle it through. It's a young, diverse field as it currently stands, and people are putting a lot of effort into conceptualizing it. There's a ton of literature, which Karen, 275 sources there is a lot, and most of it recent, I suspect. So common threads that I would like to bring up anyways. This I heard, the very first time I heard about this, it was Jeff Mulligan, who's kind of a UK thinker on social innovation, very kind of well established and well regarded on this. But at a conference said, it's social good through social means. And so for me, the social good part's quite clear, but the social means part is the addition here. And that's the notion of collaboration and engagement that I think is infusing some of the ideas that are circulating here now. That social innovation has to include these two elements at minimum to be considered even in the realm of social innovation. Some other ideas is that a related idea that it's strongly rooted then in collaboration. And usually collaboration between, how should we say it, unusual suspects. So in other words, you're trying not to just work with the same people again because you get the same ideas, but you actually bring some people call it the system, bring the system into the room. And the system would include not just the experts, so-called, but also the public. So who are affected by the decisions or by the research or whatever that is being discussed. So strongly rooted in collaboration. Strongly rooted in the notion of experimentation and at creating adaptive, workable solutions to complex problems. That was part of the discussion this morning already. And I think, Karen, you were referring to that more too, as discovery versus exploration, but certainly this notion of experimentation. It's about providing a platform or mechanism for people who are affected by the social issues to take part in co-creating solutions and co-producing outcomes or results related to those problems. There's also a discussion that goes on in the literature about should we focus on process or product or process or outcome, which goes on pretty much all the time around pretty much everything we talk about as academics, I suspect. But this is also a core component of it. There are some articles that suggest that there is a flavor to this that is actually regional or international or national in basis. And that in Canada, for example, the focus in Canada, because of just our kind of history of the way we go about things, is more focused on relationships and process and slightly less or at least as a counterbalance to the absolute focus on getting an outcome or getting a result. And then there's some other ideas that have circulated in Canada that made, at least from the communities that I kind of circled with in this, that came out of the Social Innovation Generation Group that was struck up at University of Waterloo in the first decade of the new millennium. And that came to have quite a profound influence with a significant amount of funding from the J.W. McConnell Family Foundation to kind of disseminate ideas about social innovation. And in particular, the dissemination occurred through university networks as well. And that brought a definition to social innovation that does have a Canadian flavor, I think, in part, depending on the circles you're in, which is about somehow it has to change the defining routines, resources, authority flows, or beliefs in the social system to count as an innovation. And it's by changing those structures that the sustainability of an innovation becomes more real. Without those changes, and we had a question, I think, in the talk about power. In a way, this is about changing the flows of power through the use of resources or through the use of institutional structures. So that is also something that that I've been playing with. And then another idea comes from social innovation process theory, which is about the idea that innovations sort of emerge in protected spaces. So and this is the idea, they emerge at a periphery or a protected space, deliberately protected. The deliberately protected would speak to the intentionality idea. Before they get inserted into a pre-existing regime, which would be the usual norms, conventions, structures, practices, and policies that are available in the broader institution. That somehow these innovations emerge in these protected spaces or at the periphery of that. And slowly over time, they can be inserted. And if they're adopted, that's when they become so-called institutionalized and they start to work at scale. So these are some of the other ideas that we've been trying to play with in this research. But it's very tricky. So let me just, and you're going to see how tricky it is because you try to operationalize any of that into a study, an empirical study, and you're pretty much already like having difficulty. So the first study was done with two excellent grad students, Barb Ciardo and Kristen Bennett. And it was really the first phase in a three-part study. This phase was actually just trying to get a handle on what is the landscape of social innovation across the Canadian university system. And so, so that was going to set the stage for subsequent phases in the study where we would actually talk to leaders in this environment and find out how you're leading social innovation. And then we would do in-depth case studies of particular sites in that environment to figure out how it actually takes place. We've done that work. We've published two. We haven't got to the third. So this was exploratory research. And when I look at the kind of science that goes on in many of your lives, this is very small scale science, and probably methodologically, you'll have some questions about it. But it really was trying to explore with a small team these questions and a small bit of funding from from SSHRC. But it was really to capture the initiatives in Canadian universities on the landscape at a point in time, and that point in time was 2018. That's why I said this is obviously going to have shifted dramatically since that time. It was difficult to choose methods, and it's difficult to do this because the pace of change is very rapid. Things get rebranded, things come off, things start, things stop. So it's very difficult to do this. Those were the research questions. So what SI initiatives are universities involved in across the landscape in Canada? What characterizes these? And what characterizes the overall landscape? So that all sounds like somewhat interesting and doable. The way we decided to do this, because we thought trying to actually send out a survey was not going to result in much for us, is we just said we're going to use the internet. And so we searched the sites of the 96 universities on the landscape. We then also used some other sources to triangulate that search to make sure we captured what we thought. So we used Google and the university websites directly to look for using search terms. I'll come to the inclusion criteria in a second. We eliminated duplicates. We did data extraction where we were lacking data. And I think that was 22 cases. We actually were able to get most of that by email or by phone with people working in the initiatives. And then we actually did a second round of data extraction to address a question that came up that emerged as we did it. But here's the problem, is how do we know an SI when we see one? So that's all, it sounds well and good. Let's go map the landscape, but what are we looking for? So Karen referred to it as a phenomenon. What phenomenon are we looking for? Well, that's kind of tough if you look at the definitions. And if you look at a definition like the Wesley definition, which is an awesome definition, but if you look for it, when are you ever going to see it? We've already heard that it may take 5 to 20 years for that to emerge. And then you're looking in the rearview mirror, like pretty much as a researcher, which is all well and good too. We can learn a lot from doing that, but that wasn't what we were trying to do with this study. So, so this is what we decided on. So the first one, and please speak back to this, was that it had to be self-identified as a social innovation. Someone had to say, we're doing social innovation for us to include it in the study. Otherwise, you're scanning and looking with criteria that make it very difficult to see anything. So that's what we've decided on. And we know there's very serious weaknesses with that idea, but also a strength in that we could actually find stuff. That it had an explicit intentional social mission. and that it had to have at least one of these concepts that I introduced at the beginning, that somehow it was deeply rooted in collaboration, that somehow it was bringing unusual suspects together into a space to actually to collaborate, that it was using experimental or adaptive methods of some kind, that it was encouraging people on the social issues to take part. So that's, or that it was engaged in an actual innovation process. We kept going though. We brought in the definition of niche location, which is the idea that somehow it was either on the periphery or in a protected space in the institution. In other words, we wouldn't have captured in this, I don't think, a central admin office and the central admin saying, I'm the vice president of social innovation. Right? That's not really, in a way, a protected space, and it's also not a social innovation. It's a person responsible for working in the ecosystem of other actors who are doing running the initiatives, if you see what I mean. We also thought we should be looking at, is it dealing with issues neglected by traditional academic activities? Is it pursuing unconventional questions or activities, or using unconventional approaches or methods? It need to be active and ongoing. The ongoing was really important because there was a lot at that time of one-off things, like a little training workshop on social innovation or something, which is all well and good too, but it needed to be active and ongoing to be considered an initiative. And it needed to have a clear connection with the university that could be, it's hosted at the university, it's actually at the university, or it's an external host, but the university deeply involved, and there's clearly a reciprocal relationship in the initiative. So we went and got all that data. We put what we could into, we had case files, and then we put categorical data and quantitative data into matrices. We did content analysis on the text, and we met all the time to talk about what we were finding. So again, this is 2018, but at that time, after all that process, 43% of those universities, of the 96 universities, had at least one initiative going on in it. Some universities had more than one. So there was 46 initiatives in our final sample, and some universities had more than one going on, but not more than two. Sorry, one that had greater than two, yes. We looked at how long these initiatives have been going on, and most of them were quite recent to that period, five years. In that regard, we wondered, was there attrition for some reason, or was this just growing as a phenomenon? And we don't have an answer to that. We do know that there was definitely targeted funding and policy, particularly from the J.W. McConnell Family Foundation at the time, through a program called RECODE that funded 37 projects. So we knew that, and certainly they were a key actor, but funding was coming from elsewhere to other provinces. Provincial ministries has started ministries of social innovation in some cases. So there was other sources of funding as well. And as well, we felt that it may have been simply, not simply, but a rebranding of an existing institute or research center or initiative, rebranded under the banner of social innovation. So it had been longer standing. And we did find, for example, the Schlegel Center at Wilfrid Laurier University relaunched its center to include social innovation in the title at the time. So it was just being included in existing places. We also asked in our research too, looked at interdisciplinarity, and by and large of those 46 initiatives, most were in some fashion interdisciplinary. They were not affiliated with a faculty or department or a school. They were an interdisciplinary freestanding initiative where there was a single faculty. Business management, arts and science, and engineering and environment were places where they were located. And in particular, business management, I think there was 8 initiatives in business schools. 20% of these were administered externally rather than in the university, but there was a reciprocal relationship. Usually those were kind of like hubs like City Lab or City Studio, where there are multiple actors involved in providing experiences to students to work on community-based research and projects. And it seemed from the data that some grew from grassroots work by students or by individual faculty members. Some grew by interfaculty cooperation. So I think in Newfoundland, really interesting, it was like business, music, and arts were involved in it together, which I thought was pretty cool. Or they were central administration led, but we couldn't discern from the data to actually tell you a precise number of those. That's just an observation that these grow out of different, out of different means. In terms of the activities, this may be of interest. So there was 13 different activities we could discern. We categorized them into 4 categories. The most major category was fostering collaboration and engagement in the initiatives. The second was training, mentoring, or capacity building. The third was providing new venture support. And the fourth was doing academic research about SI. When we look more closely at these activities, for example, they seem to resonate honestly within kind of the core functions of universities to begin with. So fostering collaboration or engagement, at least for the last 40 years, there have been lots of people involved in community engaged research, in community campus engagement, in community service learning, in continuing studies and other innovative ways, distance learning, other ways of delivering value from the institution and working with partners outside or collaborators outside. But in some ways, these were doing that differently. You know, there were labs and hubs and spaces created for collaboration, deliberately for collaboration, using different methods. So the people doing the work of collaboration saw what they were doing to be slightly different than those who'd been doing community campus engagement before. We started calling this community campus engagement 2.0 or something like that to kind of reflect this slight difference. But I suspect that well, I do know, not just suspect, that there are tensions in the communities of actors who are identified with community campus engagement and those identified with social innovation because of the territoriality and the kind of lack of conceptual clarity, I think, about what's going on. So I'll skip over more, but basically the key observation here is a lot of this is building on core functions, things universities already do, just conceptualized differently, and claims about using different methods, tools, and ways of going about the work. And I think that becomes important when we think about how these get institutionalized and what direction they head. We also looked at what they were focused on. What were these initiatives focused on by way of a topic or a subject or a client group or a community group? 50% talked about not having, they didn't tell us what the focus was. They were in a way sort of agnostic. In other words, these would be places, for example, where you create a space to bring people together from the community, and it's the community who tells you what to focus on. And it may have to involve interdisciplinary solutions at the end. Others were focused, so on the environment, on poverty, on local urban development, and so forth. There's a long list of ones that were focused as well. What we also noticed is they appeared to be operating in the local community or at most at the regional level. We weren't finding initiatives that were linked. In fact, we'll see in a slide in a second that were linked internationally based on the publicly available information. And the other thing, at least on the way that these are self-presented to the world, they were focused outward to external clients, which was what was talked about today as well. This notion of being outward looking and having external voices come in, but they weren't talking about what they were doing inside in order for that work to occur, because we definitely know that if you want to change the way the institution works, it can't just be you go and do it. you're going to come back and there's going to be barriers and hurdles because of the existing regime. So we kind of started thinking, well, does this mean that these initiatives currently in their current form, being young, are really about repairing and modernizing something? So for example, community campus engagement 2.0, or are they trying to transform something, but they're too new to know if that's occurring? Or is it a problem with our data? And I suspect it could be a problem. It could be a problem on all fronts there. Certainly it's a problem with our data. And the next study will show you why. We also looked at the process product question, and we found that most seem to talk about running a process. So we have a lab, we run a process, we do design thinking in the lab. Yes, we produce a product, but our main focus is actually, and our main expertise is running process. But what we realized is from the data we had, this was difficult to judge, and we suspect there's a continuum here, and ultimately somebody's going to probably have to report on some result, which would probably be in the form of a product. We looked at relationships across the landscape. Only a quarter of these seem to be linked with other universities or other post-secondary institutions, and at least by way of the data that we had on them. And the rest existed in the institution itself or alongside the institution. We also looked at information about relationships that were non-university, and what were reported on the sites were relationships with government, with nonprofit agencies, with foundations, with the private sector, and then non-university post-secondary institutions, by which we meant community colleges, for example. And what data we could get about funding off the sites, and not everybody reported, but this was just an approximation, was that, and not surprisingly, a lot of it came from foundations at that time, because there was one major foundation on the landscape providing most of the funding. Private sector was involved, but government, once you add it all up, became the majority was coming from three levels of government. Sorry, I'll go back. What was interesting is the universities were recognized as providing funding to these, just not at the scale of other actors. So quick discussion of this, and I'll go on to the next study. The first that this shows that at that time, institutions were intentionally trying to do social innovation. They were self-professing to be doing it. That there was diversity by way of the disciplines that were involved in interdisciplinarity. There was diversity in terms of the foci. There's diversity in terms of the activities and the partnerships, but there was also a commonality. They were young, they were local and regional, and they seemed to be outward looking. And then this observation that they build on core functions, even if they're meant to be repairing or modernizing them in some way, they're building on core functions in the institution. So there's some of our limitations. Obviously, it's publicly available information. We're not in control of the data. We didn't make an instrument to capture it. We just recorded it in our instrument. There definitely is more diversity than included. If you just go back to the discussion about conceptualization, there's going to be more of this going on than we captured in the study, much, much more. And we've already heard about some of the initiatives that are going on here today. And then there's rapid change, so it makes it difficult to study. I might just stop there for 2 seconds, and I'll go on to the next study. Oh, no, I won't. I've got 5 minutes. Okay, let's go there. Okay, are you sure? Okay, so this study was on social innovation leadership. I'm going to go right to the point on this one then. This was a study where we took 22 practitioners who are experienced practitioners in social innovation and asked them what it entailed to lead. And we used a group concept mapping process to do this, which was supported by a software product called Global Max. And basically, I'll show you the method to do that. There's the method. You ask them, in your experience, what does it entail to lead social innovation in a university? They come up with ideas. In this case, they came up with 108 ideas about what it meant. Then in the software, they actually sort those ideas together. They put them in piles together as like things, right? There's an affiliation between these ideas, and there's non-affiliation between these other ones. So they do that, and then the software calculates statistically how frequently they're sorted together and how infrequently they're not. And then that gets put into a map. I'll show you in a second. And then we do cluster analysis on it, and then we interpret the map. But we interpreted the map with the participants in this case. There's the map. So that comes from the software. So the points that are located closely together were more frequently sorted together, which means they're more likely have some affinity with each other. So a point on the left side will be very different than a point on the right side. And then what you do is you, as researchers, analyze that and find a scale at which there's a resolution of ideas in a cluster that seem to be most like each other. So in this case, we scaled from 6 to 13 and ended up at 9. So these are 9 clusters of concepts that each one is kind of freestanding in terms of that interpretation. So you'll see some of the ideas here. In cluster 1, they're more like traits or behavioral characteristics: perseverance, energy, enthusiasm, creativity. Across the map, you'll see it's more focused on big picture thinking, a focus on the system, how to change things at a system level, how to build community, and so forth. I'll give you a few more ideas. So being comfortable with messy problems on one side of the map. On the other side, shift the structures that maintain the status quo. So you kind of work through the map this way with different ideas. And I'm happy to share this paper with anybody who would like to have it. In the middle was a cluster that seemed to have some core leadership ideas in it. I'll come to that in a second. So then what we did was we took that as researchers and worked with the participants to interpret it. And we landed at this kind of conceptualization of what it entails to lead social innovation in a university community. So you see there's 3 zones that we're talking about. The zones really are a level of focus. So there's a level of focus that appears to be focused on the individual leader, which has to do with those things like we said, traits and mindsets to deal with uncertainty, embracing messy problems and adapting to change. And then there's a zone that seems to be more focused on relational parts of the work. That has to do with developing the initiative and gaining momentum for it, which means working with people and communicating with people, attracting attention and engaging stakeholders, building a team and networks while strengthening the relational ties. And then it comes around to an institutional system focus, where you're talking about navigating the system and institutional dynamics and structures and dealing with power and authority and all of those kinds of things. So basically, that was what they told us. And on the surface, they said it resonated, but they said it depends on how you look at SI, where you're going to find yourself in this map. If you see yourself as a social entrepreneur, you may locate yourself differently in this map than if you see yourself as a systems change person. And you may read this differently. But either way, the ideas resonated. You just may interpret them differently as a leader. Key themes were there's an orientation to addressing social problems. Yeah. Yeah, this was key important because it didn't come out in the map. It comes out of them when they read the map. You see, I can read this map and say it's about changing the system, but my main point is I need a North Star to read this map. My North Star is about changing something that's important to my community, to my society. And that's what's core to interpreting the map and to moving forward. There were some other tensions that could be talked about. I'm sure they will be at the table here when we have the session, but the tension that leaders have in terms of remaining steadfast to a vision while also continually adapting. And ideas failing, and you need to regather strength, that perseverance and resilience and so forth, find your North Star again, and go through another cycle of this leadership process. So that seemed to be a really important kind of tension that's in there. Another was the tension between individual and group. And theories about leadership that focused on individuals they weren't that keen on those theories. They were more keen on collective leadership models, generally speaking. Yeah, and then this problem of leading local projects, basically while keeping your eye on the big picture. And that's this question about measuring change that's been asked many times today. So all of that to say, that's where things were with this study. It basically shows that leading social innovation is multidimensional, is dynamic, and it's challenging for people to do. The map, hopefully, at least according to the participants, said it could serve as a point of reflection for strategic direction, for professional development, or even for curriculum design. And then we have some stuff in the article about connections with extant theory, but no one leadership theory even kind of speaks to the totality of this map. I think there's some bricolage needed theoretically to kind of pull together leadership theories. So, you know, strategic leadership is important, but so too is actually transformative leadership that's focused on social justice issues at the same time. And that forms a tension. If you're doing strategy, sometimes it's hard to do social justice. So bringing those two together, adaptation and then authenticity are also part of this. So anyways, all that to say, leadership theory doesn't have a lot to say about this currently. We have to pull it together ourselves. So I'll stop there. I have some questions to ask if you want, but I'll leave it up to you to ask questions too. Sorry for taking an extra 2 or 3 minutes. You were an awesome timekeeper. It's my fault.
Okay, so this question is from Judy Birdsell. My question may be outside the scope you want to address, and if so, totally fine. Great presentations by all. Oftentimes, innovation embraces a stream of work that leads to commercialization and benefit measured perhaps in 2 dimensions, social good and economic good. Could speakers, if there is an opportunity later, address the dimensions of seeking economic returns in the form of jobs and enhanced revenue?
That's an awesome question because it's addressed to everybody else but me. I'm happy to leap into that, both by way of just saying what a great question, because that really is one of the core tensions for universities in this era. Is exactly that question. You know, I don't know how to say this exactly, but you know, we live in a world where the market logic kind of predominates our institutions. And so this is causing a focus on economic activity in them and the transactional nature of economic activity to kind of come to the fore. And so the leadership ideas that I've been trying to explore here are showing how challenging it is, not just to have an idea, but literally to push back on some of the fundamental logics that are norms. They're norms in our institutions that you'll be pushing against to try to demonstrate social impact over a long haul in a situation in which you're trying to show return on investment in a short haul. Yeah, so that I don't have an answer to the question other than to say it's an important question and it needs to be unpacked over time in this community for sure. I don't know if anybody else wants to respond.
Just in terms of what the literature is saying about social innovation and social enterprise. And so what we're seeing is more of a hybrid model that's emerged, because if you're going to sustain social innovation, given some of the challenges with funding, smart social innovators are actually building alongside a social enterprise to generate enough dollars to keep the social innovation sustainable over the longer term. So that's sort of what's emerging. And the boundaries between those two that were quite discrete a while back are very blurry now.
Mhm. It would be interesting to explore the governance models for doing that then. Another research project.
Oh, here we go. Oh, sorry about that. Thank you very much for your presentation. So I come at this from a slightly different angle than a lot of folks in the room. Very interested in the educational curriculum development implications of social innovation and its integration into post-secondary education. So given that we have this mandate as an educational institution, I'm wondering what your insights are on how we can very intentionally engage students and empower them to be social innovators, going above and beyond. Well, if they happen to hook up with a professor or a supervisor who's already doing that work, great for them. But how can we be more intentional, perhaps even at the curricular level, or any thoughts on that? And we have trainees here all the way from the undergraduate health science, undergraduate medical education, graduate school and we're very interested in postdoctoral fellowship development as well. So any piece of that you want to maybe provide some insight would be great.
Sure. So some of the initiatives that we looked at, when I looked at the activities, if I call them back up, I'll try to remember the activities. But in many of these spaces that were in the study on the landscape, one of the core activities was trying to develop change leaders or social change leaders or social innovators in those spaces. In other words, it was a core activity designed into the initiative itself. The initiatives I should have said on that slide, many of them have, I think the average in the mode was 5, at least 5 of the 13 activities the initiatives are doing. So, and across the 4 categories. So some may be doing more research and less, engagement. But either way, that's one idea is if you're thinking about spaces that you have that are being shaped here or that exist, is to think about how to infuse that with a activity or programmatic activity that would create a space for students to do that. In some cases, those are directly why I talk about the core function. In some cases, those are hooked directly into the lifeblood of the institution. In other words, they become part of a program, part of an academic program. As a community service learning experience, for example, or an experiential learning opportunity that is created and gets hooked into a program. I think Radius at SFU, for example, works with the health sciences faculty, has a lab for health sciences social innovation, and a core component of that is running programs for health sciences students to get involved in change making. So that's one angle to answer that question. The other is there's intermediaries on the landscape too that I didn't have time to talk about. But the main one, the biggest one kind of globally, although they've had to recede a bit, is Ashoka, which has a change maker program. Many Canadian universities have signed on to that historically. And that provides already a pre-existing kind of curriculum and model that could be adopted. Okay, it's ashoka.org. Its emphasis is, my reading of the emphasis is more towards social enterprise and social entrepreneurship, and probably, so this is why I mean, this is why I'm interested about things coming together, because there has been a fracture in the community by and large, and in the definitions themselves, where social entrepreneurs and social enterprise communities existed over here, and social innovators were over here, and these people came more from what, like, again, it's a 2.0 movement, kind of like, how do we take community-based action and organizations and turn them into something more innovative by collaborating with the university. But it seems like these are now starting to fuse and become more hybrid, and that's super exciting, but also raises challenges, I think, for governance and for how these things are funded and emerge and everything. Is that helpful? Sort of, okay. Yeah, okay. I'm happy to share other links and resources for intermediaries, other sources of curriculum for you. Yeah. Okay.
Okay, another online question from Jennifer Jackson. Could you comment on leadership and navigating intersectoral collaboration? I hear the need for partners. How do we balance the urgent social needs with relationship building, timelines for approvals, or ethics?
Wow, these questions are so hard. So that's intersectoral leadership. That would be really, because actually that question's awesome. We didn't actually look for leadership theory on that in sensitizing ourselves or in triangulating the findings from the study. And so first thing, you've alerted me to maybe try to cast about for that, because I think that would be crucially important to this. The only thing I have a colleague who helps with intersectoral, interdisciplinary work in the health professions. And I remember asking him about how to run my research center, which is trying to actually work interdisciplinary and cross sectors on complex problems like poverty and homelessness and so forth. And basically his response, he said from the literature he knows, is like, you need a project to bind people together. By which I think he means largely academics, but also others. But yeah, that was his advice: is you need to develop projects to bind people together. If you get together to talk, it will just spin off in all directions, and people will eventually leave the collaboration. That's as much as I can do for now. But thank you for the question. It's fantastic direction for thinking further through this.
Great presentation, Peter. A question I have is, how do we monetize the benefits for academics? And so to me, it seems intuitive that that academics who don't receive remuneration for their output per se, but rather for, they're here doing their activities, that it would be easier to engage them in taking on the biggest societal challenges. But currently what we see is that most of us like to do our pet projects, right? And so I'm wondering if there's ways when we think about social innovation, which you've indicated requires partnership with community, that we could make it attractive for academics to engage in those relationships, which requires obviously a lot of work. We just can't be in our offices and then are incented to then pursue these trickier issues.
Another amazing question. So I'll try to reframe it a little bit, just because I don't have a specific response to it. But when I talked about these initiatives being are they outward or inward looking or both? And are they focused on repairing and modernizing something, or are they focused on something more substantial? I think that speaks a bit to, first of all, to what you're asking me. Because to do the work that you're describing, which is to solve complex social problems, clearly your question is indicating something needs to change in the regime of the institution itself, which is effectively either policy about remuneration, it could be collective agreements if those apply. There's a whole bunch of parts of what I'm referring to as a regime in the institution that create barriers and are sclerotic to the need for people to do the work that they're being asked to do through this. And for me, that on cluster 7 of the map, this navigating system, institutional, organizational dynamics and structures, this is the core. This is really a core question for social innovation leaders in universities is, what are the structures that are getting in the way of realizing a definition of social innovation like the one emerging at the University of Calgary? Can we identify those through a research process that has some rigor to it? But it can't just be research, because decision makers, no matter where they are, don't just respond to research. They respond to also other influences, which may involve, political work, political as in small p political, or possibly big P, but I suspect small p. So there's a lot more detail in the article about the importance of champions and allies, and where you find them in the institution, and how you, So I guess I can't answer your question, Tom, other than to say that could be very well be one, one element that needs to be changed among many others. And part of the challenge of social innovation is also working across disciplinary boundaries. That's not just an epistemological question. Like that's a practical question. That's also like a culture question. Right? And that needs to be resolved as well in some fashion for us to make progress on most of these complex challenges that require it. The people working in community engagement, so the community campus engagement 1.0, have also been doing this work historically to figure out like how do academics get rewarded for doing something that is only supposed to be a small percentage of their work, which is to actually do service in the community. Right. And they've been onto it. And they've been talking for years about trying to change academic culture and trying to change collective agreements if they apply, or faculty association agreements with the university to allow for a different portfolio to be put forward for tenure and promotion processes, for other matters, for leaves, for sabbaticals and so forth. So I think there's a lot to be learned. You pointed to all this research that needs to be done. As far as I know, it's not done. And I call it governance research. How do we govern? How do we go about governing this process that we're trying to make unfold? Sorry, I can't answer. Maybe someone else has an answer. There. Yeah. Yeah.
It's a little bit of a difficult question because it's around intellectual property ownership and who owns the intellectual property. And I think, the University of I'd like to challenge the University of Calgary to look at its IP policy, because I look at Waterloo's policy in comparison to the U of C and even other institutions across Canada. And is that a barrier that we're creating internally to allow social innovation to truly form and move forward? So maybe more of a statement than a question.
Could you explain more about, like, if it's not breaking confidentiality of some kind, like what is it about the IP policy here that you think is
the IP policy
impeding
is
it?
just it's dated. It's old. I mean, the IP policy here at the U of C hasn't been reviewed since the 80s. And so much has changed in our world, not only just locally, but globally, through governments, also through institutions. And I think it's time that we look at that and create a new modern policy for the institution that allows, it is inventor owned, which is great, but it doesn't help when you have an individual that is looking to claim ownership on something when you're really trying to benefit the greater good of society. So if you are looking to reverse, like our program to reverse engineer the process of working with community agencies through institutional support, but then where does the IP lie?
Mhm.
And so to Karen's point earlier about, most will create a social enterprise to sustain it, which is okay, but that's not always the answer sometimes. It can be very complex. So more of a statement than a question.
It's a fascinating topic and problem, and it intersects with the other problem of economics / like the other question that occurred earlier is, where do we begin to negotiate that 2x2 with these things?
I'd be curious to see what Waterloo has said about that. I need to do some reading on that because their policy is much different.
Mm-hmm. Yeah. So when I got all excited about this, when I was looking at public admin, and public admin is a very sclerotic institution too. And I started to see all these open source initiatives like open science, and that was, the beginning of, Creative Commons and like all of these other sorts of solutions to these kind of problems of like, when does something, why do we privatize everything? And when we privatize it, what costs are we externalizing onto whom? And worse, if you take a model where the idea is it's competition, so let's gobble up the competition so we never get good ideas coming out, that kind of behavior just doesn't seem resonant for me whatsoever on a terrain where we're trying to lever as much capacity and resource we can out of our existing institutions and enjoy our lives as people who actually want to commit ourselves to doing something differently and better for each other. Yeah, that's basically what. So I don't have a response, but it's really interesting. And I know I won't reveal confidence, but this trying to emerge in my own university, there's like a year or two of discussion with legal before you even get to the point of doing something, right? That's even hypothetical, right? So, so yeah, anyways.
Test. Hi.
Hi.
So I actually have like 3 combined experiences to address. So
Awesome.
I have a piece of IP that I had to pull out of the university, go through the tech transfer office, and then decided to set up a social enterprise because I couldn't do the work that I wanted to do within the university. But I still wanted to work with the university. So then we found a facilitator to be our PI on all of our research projects within the university, but couldn't pay her to be a part of our organization for conflict reasons. And then had to find a different person to actually be our scientific advisor for the company who we could pay to do the work that the other PI is actually already doing. So there are systems in place, but they're really bad. I think there's some really good conversation happening today. And as a community stakeholder who's trying really hard to engage in social innovation with universities, I am so happy to see these things happening. So if you ever want to talk to someone who's struggling to work through this process, I'm always happy to connect.
Thanks for that.
Thank you. And that question is actually a beautiful bridge to the panel that's up next that will demonstrate the different doors faculty members can knock on when developing social innovations here and the interconnections that occur on behalf of the innovator behind those doors. Introducing and moderating the panel is Dr. Jamie Day. Jamie Day is an administrative director for the O'Brien Institute with a PhD in neuroscience, with over a decade of experience leading research institutions, including chairing the Social Innovation Task Force that led to the Social Innovation Initiative that Dr. Benzies now runs. Jamie.
Okay, so we've talked a bit this morning about what is social innovation in a university setting, what is social innovation at the University of Calgary that the group that Karen leads, the Social Innovation Initiative that you'll hear called SII. What do we want to call it here at University of Calgary? And now we want to get into a little bit about the how. How would you do social innovation at University of Calgary? How would you do it more efficiently and effectively if you've now realized that you're actually already doing social innovation? So here is a group of our colleagues at the University of Calgary who are representing various innovation accelerators, different groups at the University of Calgary. And we hope that this last agenda item before our networking lunch will be a little bit more fun than a traditional panel. So we're going to do a little play for you, a reenactment of the university's social innovation ecosystem at work. So complementing this play is the information that are linked in those QR codes. So there's a little description of each of the different accelerators, and then some figures that explain the innovation ecosystem here that's quite complex. It is a complex ecosystem, even for the people who are in it, or people like myself who've been trying for many years to understand what it's all about. So it's understandable that most researchers feel a bit daunted by it. And that's what we want to address here. So the reason it's complex is that you have a lot of expertise, a lot of knowledge and evidence in the field of innovation to be had from these experts. And there's some strategic overlap and redundancy between the different shops, the different accelerators. So people like me who want a simple answer keep asking for a roadmap through this ecosystem. And you'll see some figures like that at those QR codes. So there's been efforts at that. But as Karen, the SII's fearless leader, is fond of saying, any door is the right door to knock on in this ecosystem. And that's the title, Knock on Any Door, of our little play here. So yeah, you may get confused where you need to start in your innovation journey or continue on in your innovation journey, but these people understand that, and they're really good about redirecting you if necessary to the best accelerator group to support you wherever you are in your journey. So a few disclaimers about our panel and play. Although this reenactment is based on a true story, the continuing story of Dr. Megan Edwards' interactions with the innovation ecosystem, we have taken some artistic liberties. I'm not going to do the traditional introductions. The introductions are part of the play. You'll see we have the opposite of a manel here, but in real life, all genders are welcome. And unfortunately, the realistic flow of our script is hampered a bit by the fact that we only have the one roving mic, which is required for the online audience. So part of your participation will be to use your imagination to overcome these little limitations. But the major part of your participation will come at the end with the more traditional Q&A after our play. So. Yes. Without further ado, I give you social innovation at University of Calgary. Knock on any door. In scene one, Megan speaks with a representative of the Hunter Hub. And
hi, my name is Megan Edwards, and I am an associate professor in the teaching stream at Community Health Sciences, and specifically in community rehabilitation and disability studies. And so I'm kind of confused because myself and my colleague, Katrina Milani, who's in the audience today, we're a little confused. We want to somehow bring together community and academia and translate some of this awesome stuff that we do into social action. And we really want to help our community partners as well by making sure that things that they're doing are evidence-based, they can access evidence, and that we work together for systems change. Now, Katrina mentioned that there is a Hunter Hub for entrepreneurial thinking. And so we're sort of wondering, you know, we have really great connections in the community, but we don't have the resources for the work that we're trying to do. We really want to do an environmental scan, and we want to see where the gaps are. And so, do you have any ideas or know who else I should talk to about this?
Oh, hi, Megan. Yeah, that sounds really interesting project. And first of all, let me introduce myself. So my name is Fei Chen, and I'm the manager of venture programs at the Hunter Hub Entrepreneurial Thinking. And one of my role is exactly helping you as a researcher and navigating the system to see what resources at Hunter Hub can really support you to further your research and also your social innovation projects. I'm not sure if you have heard about the Launchpad and also Map the System program that we offer.
No, I've never heard of it.
Don't worry, that's who I am to introduce you to those. So Map the System is a partnership program that we have with the University of Oxford. So it is really a process, a discovery process for participants of any disciplines who have an interest in terms of social and environmental change to create an impact. So participants in a Map the System program really dives really deep into the issues or issue that matters to you or to them, and really take the time to explore, probe, and research on all its connecting elements and factors, and later sharing your findings with the world. So sometimes when you're doing research problems, especially when you're trying to address the social needs, and you're feeling like you're trying to find problems, it's like peeling the layers of onions. And like, oh, before I solve this problem, this is another problem I need to solve. And then there's another problem, right? So this is exactly the process, the system thinking education process that we're gonna help you explore how well you understand the landscapes of problems or social needs you wanna change, and also how well you research on the current solutions that's currently available, and then how you can bridge the gap with your solutions from current solutions to the problem you want to solve. So this is really a program that is not just a challenge, and it really can really help you with your project environmental scan, also gap analysis, and also really great networking opportunities in national and also international level.
Sounds pretty daunting.
Don't worry about it. No, that's not really. So I'll love to share with you more information afterwards for you to explore further. And we can also talk about it, to think about it. Maybe another program that may be more relevant to you now is the Launchpad program that Hunter Hub is currently offering. So the Hunter Hub Launchpad program really helps build entrepreneurial thinking skills across everyone, all 14 faculties, not just the students, but also the graduate students, the postdocs, researchers like you, faculty members, with an idea or even without an idea to start, how to start a startup or social innovation projects. Throughout the Launchpad, it's a 6-month program that you will experience weekly workshops and also Launchpad live sessions and also seminars, and then you'll be paired with coaches as well. And also you'll be able to join the final pitch competition, which we call liftoff competition. So really in this program, you hone your entrepreneurial thinking skills in your real world projects you are trying to solve, and then really designed to create an impact afterwards. Throughout the program, you'll learn. So we have 4 modules. You'll learn about the startup strategy. What does that mean to be an entrepreneur? What does that mean to social innovation, right? And how to start a startup, different modes of different kind of startup venture ideas. And then you're going to test your project ideas or doing market analysis, market validation. So you're not just throwing anything onto the wall to see it stick. So you're really getting the feedbacks from the potential market of people that will be able to benefit from your projects. We're going to explore that. And we're also learn about the soft side of being an entrepreneur, learn about the funding strategies, how to get grants, how to bootstrap, how to apply for fundings, right? Those are important things, and how to negotiate, how to understand the legal side of things, understand IP transfers. So you're going to learn all about that. And also we're going to learn momentum to scale is where you're going to learn about growth strategy, how you're actually going to bring out your projects to the community and to the people that who are going to benefit from it. So it's really create that sustainable organization that with the ongoing value. So this is what the Launchpad is about. So you're able to really dive in and have that experiential experience to test your theories and then learn about the tools and approaches and how you approach with your projects.
Faye, I don't have time for all that.
I completely understand. That's all the researchers that told me, because you have your research initiatives, you have classes, you have everything ongoing, and how do you balance it out? So don't worry about that. You don't have to do all that. So we also know that there are trainees that who are dying to learn all those different kind of things related to social innovation. So, and also just want you to provide a real world problem for them to solve and for them to work on. So how about we set up with a trainee or 2 trainees for you, and who can be part of your environmental scan, a gap analysis, and then to really help you to work on the projects. And also, I bet you'll be surprised how much of the things that they can learn in a program and which will benefit from your projects. Yeah, and I think one great thing I'm thinking about my colleagues from the Innovate Calgary, Joanne, I think we have some fund from Hunter Hub as well to fund trainees in partnership with Innovate Calgary. So let's bring Innovate Calgary in the loop.
Hello, hello. Hi, Faye.
Who might be interested in Innovate Calgary's Social Innovation Hub program. So could you please help us explain a little bit about Innovate Calgary?
Great, I'll just put you on speaker. Okay. Megan, you might not have known, but Faye has some fantastic AI where she was taking notes and sent them to me during your call. So I've already had a chance to review, and I'm really happy you had a chance to talk to Faye. Hunter Hub is a fantastic place to start to flesh out your ideas, strengthen your entrepreneurial skill set, and get access to some great tools, and to get a sense of sort of the landscape of the journey. Once you've picked up those skills, and once you've got something concrete, that is where we are very welcome to introduce you to our door at Innovate Calgary. So for us, You have something, you've moved past an idea and you've made something. We are now going to really sit in the stage of validation. We're going to get comfortable. We're going to get real deep in there. So we're going to test out, is the problem that you're solving the most acute problem for the community that you're working with? Is the solution the best fit for the resources and needs of the community? And what are some options for making it sustainable over the long term? So we really sit in validation to make you really confident about the foundations of the problem and the solution you're working on. As an example, we have an incubator program. It's a 6-month program. I can hear a little bit of breath there about 6 months, but okay, with me, so just give me a chance to give you a sense of everything involved, and then I'll give you a sense of some other options as well. So in this 6-month program, you get expert advising access in the specific industry you're working with. You get that critical student support that helps you with those time commitments, targeted training workshops, a monthly roundtable, all with the idea of helping move this project off the side of your desk. We understand with faculty, you have so many commitments. You need those supports, those resources to help you decide, is this something that has legs? Is this project something that I can move off and really commit to know if it has something that'll last over the long term? So we want to work beside you over that 6 months to make that decision at the end of it, if it's a go, no go. But the R2SI program is just one of the programs we have at Innovate Calgary's new Social Innovation Hub. And this is a hub that really focuses again on validating, developing, and scaling social innovations. We do this through formal programs like the incubator, but also, my dear, we have dedicated coaching where you sort of set the tone of the relationship. You can check in once a week, once every 2 weeks, every few days. You have a dedicated coach who will work alongside you. Networking opportunities so that you can expand your work to a broader audience. And we can talk about different types of funding beyond just grants. What are different types of social financing available to you to help your project be sustainable over the long term? The bottom line is we know that moving an idea into action is difficult. It's not easy. We really invest in people, in coaching. We'll meet with you as much as you like, as often as you'd like, as little as you'd like, and get you the resources that you need. Because we understand, especially for academics who are navigating between academia and the innovation ecosystem, a lot can get lost in translation. There's a lot of assumptions. So we want to work beside you to make sure we're navigating you through those two spheres. We need more voices in the innovation ecosystem. We need different perspectives. We need different problem solving approaches. We need you, Megan. So we want to work with you to make sure that your idea gets launched and has the impact, and that we find the right journey for you to impact. Moving forward, I'll check in with you in a few months. Maybe you'll take a stab at the Launchpad program, and I'll connect back in with you, and we'll decide if maybe the incubator program is a good fit for you then. But let's keep talking. In the meantime, we have a newsletter at the Social Innovation Hub, Social Innovation Hub Innovate Calgary. So I'd really encourage you to sign up there, and we can just start to introduce you to some of the events, some of the people in the ecosystem, and then we can take it from there.
In our second scene, Megan is starting a new project and is not sure where to go for help. Innovate Calgary and Hunter Hub offered excellent support through their respective programs, and Megan and Katrina are developing the Equity Hub as an outcome of that work. But now Megan is taking a different step with a different support needs and has submitted the innovation intake form. Let's see what happens next.
Hi, Stephanie. It's Tara Barnes of the Social Innovation Initiative. I'm just calling because I received an innovation intake form yesterday from a researcher in the Department of Community Health Services. She's wanting to conduct research with the community agencies on their perceptions of being involved in the academic research endeavor, essentially research about research, if you will. Our SI team reviewed and agreed that it fits within the social innovation purview of both the Social Innovation Initiative and the Social Innovation Collaborative Group because it addresses a social need, many actually, since Megan's trying to improve university interactions with all sorts of community agencies who are addressing social needs. It relies on and builds relationships and collaborations. It's innovative. Again, it's supporting all sorts of innovation. Since it's trying to improve U of C research interactions with community partners, it's intentional and includes plans for implementation and execution. And it's definitely aiming for an improvement of university partner interactions to enhance social and good. Just curious to see what your thoughts are quickly, and do you think knowledge engagement can help here?
Thanks for this great phone call, Tara.
Yeah, I definitely think knowledge engagement can help in this context. It sounds like the researcher has a good idea of what they're looking for and what their needs might be, and the knowledge engagement team can really help with some of that partnership with community organizations. So we do partnership matchmaking for researchers looking to connect with community organizations, particularly in those social sciences, humanities, and community health and policy spaces. So I think the matchmaking support that we offer could be a really good fit for that. So I think we could happily set up a consult with Dr. Edwards and just talk more about her needs and what kinds of community partners she might be looking for. And that can help us to kind of create that long list or short list of potential partners that she might be able to connect with for those needs. There's probably a couple of other ways that we can support too. We also have a knowledge engagement newsletter that goes out to community organizations as well as the university. So I think that could be a great place as well if we wanted to talk about different levels of connection with community partners too. And I think some of the supports around identifying potential funding opportunities, it sounds like for this project, there's already probably some funding in place, but if there's future stages of the project, I think that could also be something that our team could support with. So she can reach out to, or you can connect us directly, or she can reach out to us by email at knowledge.engagement@ucalgary.ca. And we can set up a consult either with myself and the manager of the team or with our knowledge engagement specialist to talk more about that. Does that sound okay?
That sounds fantastic. I'll connect her via email and we'll happy to hear what moves next.
Later that same year, Megan has met another hurdle and has another request for support. This one is proving challenging for Tara and the SII to triage. Let's see how they rise to this challenge at their meeting of the Social Innovation Collaborative.
Great, thanks. Okay, next item for this Social Innovation Collaborative meeting, a little bit of a troubleshooting request for an innovation idea that seems to have run into a little bit of a barrier. You may already be familiar with Dr. Megan Edwards. I've checked in with her that her previous support requests have been dealt with, and she said great things about the support that both Knowledge Engagement, Hunter Hub, and Innovate Calgary have provided. That said, her current project involves surveying community partners about their research relationships with UCalgary, and she's looking for strategies to increase recruitment among these partners. Our Social Innovation Initiative team, Dr. Benzies, and I have worked with her on healthy equity resources, work plans, and various communication approaches, but we weren't sure if any research groups in the broader University of Calgary innovation ecosystem might have good advice for her on this issue.
That's something we can jump in and help with here at W21C. So we are, as you know, a health research program housed right here within the O'Brien Institute. And we have a large multidisciplinary team of mixed methods, qualitative, quantitative researchers representing many disciplines from across campus. And recruitment is certainly one of the things that we do, but as she progresses through her project and if things evolve, we can also help her with some of the other activities that we do. So survey design, data analysis, literature reviews, things along those lines. So we can definitely meet with her and have a conversation about what she needs to do and set her up with one of our research support staff. We're either research assistant, research associate, depending on who she's looking for, and help her with that.
Fantastic. Any other suggestions? Oh, Sarah.
Yes, thanks. So as you know, I work with MyTax. MyTax is a national organization that helps to provide support for exactly this kind of scenario. So anytime we hear about a researcher who's looking to work with community partners, particularly outside of the university, this is the perfect moment to think of MyTax for bringing together these two sides. We have a number of different programs. In Megan Edwards' case, I would probably recommend our Accelerate program, which is our most popular program, which provides funding for between 4 months and 4 years for student interns or PhD graduate students and postdoctoral researchers to come and support on projects, particularly ones where there is a cross collaboration between the university and a community partner. So this sounds like a perfect opportunity for her. And we work with researchers from all disciplines, from all the universities across Canada. So I'm sure we can find the right people to help connect Megan to.
That is perfect. Those are both great ideas. Thank you, Jeremy and Sarah. I'll introduce you to Megan, and I'm sure she'll find your support super helpful.
Our fabulous actors. And what do you think? They're going to stay in place for the question and answer period. So what do you think? Do you or your colleagues have any projects you want to put through this process? Any questions or comments on feedback on UFC's social innovation ecology itself? Or any questions for any of our actors on their real life work? And while you are pondering this, I wanted to ask the first question of Megan. So this was based on reality, but I'm curious about, how accurate was it? Where are you now in the process? What's going on?
It was pretty accurate, like when you say Katrina, we have been through all of these. Yeah. And I continue to work with most of the fine people at this table on this project. So Katrina and I did end up building the Equity Hub, and we're working hard on that. And I'm the community capacity and education lead there because I'm in the teaching stream. So a lot of my work has to do with student roles in the community. And I've been able to really carry out quite a bit of data collection on that topic. And Tara has helped me in other ways, like organizing my, contact list and meetings and how people are connecting with each other and when. Like she helps me with things like that even, because that's not my strong suit. Keeping all the balls juggling. And right now, my student who is doing this work around looking at community relationships, especially in the student role, and then how we're working together for health equity and equity in general. We've been talking about it some more, and I've continued to talk about this with Joanne, and we just spoke about this last week. And really, we want to expand this project because the initial data that we're getting, they are indicating some really interesting things about what our community is saying and areas for improvement and ways that we can ensure that we're having impact, multi-year impact. And so we're thinking about expanding the project, and then we're talking to Sarah at my tax around getting some support for that. Yeah, so anyway, it's all good. It's moving very well, thanks to these folks.
Success story. Excellent. Any questions from the audience or online? And we can still, we can run that, mic, and then if, depending on who has the answer, can come up and use this mic to answer. There, Nishan has one, Heather has one. Let's go, Nishan first.
Thanks. That was fantastic. I've put this question to, I spoke to Joanne at Innovate Calgary, but what about questions that are related to legal? Because it's involves the UFC and legal's often hard pressed. Where in the pipeline is the best place to go to ask questions about legal?
Who has an answer for that? They want to step up? Anyone? Sure.
So knowledge engagement is housed within research services, and we do have a research services legal and IP team. So you can always reach out to them with questions about contracts, around partnerships, around any kind of data sharing agreements or financial agreements, project contracts, that kind of thing. So I would say legal and IP in research services would be a great place to go for that. Thank you, Nishan, who is also in research services.
And I think Heather over there. Okay, Faye has an addition before you start.
I'm not sure if everyone knows about the fantastic resource at UCalgary is the BLG Venture Clinic. So we do have a venture clinic on campus. So it's hosted on Hunter Hub that they have a weekly office hour. So we have a professor who has really written kind of like the Bible of the entrepreneurial legal side of things. So we have Calgary law students who are coming in, and then you can come to Hunter Hub and ask them any questions regarding your patent tech transfer, and they have all knowledge, and it's all for free. So check it out. So I'm happy to make the connections for you. Yeah.
Hi, thanks for the panel presentation and the fun way of presenting the material. I really like that. So I'm a big fan of hackathons, and I've chatted with some people like Sarah and Aleem, and different people know that I love hackathons. And we've had some really great experience on the global health side of even pushing ourselves to think more outside the box through engaging with students from other universities around the world on a joint initiative to think about a social need and come together as an interdisciplinary team. And I've liked hackathons as sort of a way of not only looking at exploring a social need, but also a way of teaching students some skill sets and how to interact. And I was just wondering if there's any sort of thoughts from the panel about that process, or comments on the evidence of how that builds students' skills, that type of thing.
That's a fantastic question and also great timing. So the Hunter Hub, we have Hunter Hub Solutions Lab, which is a hackathon that offers social change for students across the university to participate. And we also offer workshops and also mentorship along with that hackathon. So this year we're still accepting applications, and that's part of weeks-long process. And at the end of the hackathon, we're going to be paired with the teams and work with the teams, and they're going to submit a video kind of pitch of what they're trying to solve the problem. So this year's theme, and we usually partner with the Office of Sustainability to work on the 17 the United Nations Sustainable Goals. And this year we're trying to tackle the climate change. And in the previous years, we did food resilience and also the Zero Waste Campus Challenge as well. So we can talk further, and we would love to develop more of that kind of hackathons for students to be participate, to get a feel on what that feels like. Yeah.
Thanks. And can I jump in with one more question, Jamie? It's a different question. Kind of for my health sector colleagues, Laura and I were talking earlier about, I guess just sort of thinking back to the earlier presentation on educational social innovation leadership in the academy as well. Where do you see the line between quality improvement and social innovation? Right? And what makes an innovation an innovation? I'm really interested in that because we focus so much on quality improvement in the work that we do here. So where is that line? And I was reflecting a little bit on the difference between a social innovation that aims to, I believe the words were update or, sort of improve versus transform. Kind of thinking more broadly about what do we really mean there around social innovation, and does it have to be tied to social transformation or not to really count as a social innovation? Thanks.
That's a tough question. Do you guys want to, or should I call up Karen, or what do you think? Okay.
Thanks for the great question, Heather. So I think that it's an interesting one where it's not a well-defined line. And I think that if you asked every single person in this room, that you would get a different answer from every single person. There is overlap between quality improvement and social innovation. I think it's a common thing that happens between disciplines where people might use one term in one discipline or one area or even one sector, and they might use a different terminology in another. So from my perspective, quality improvement is more focused on the process. It's more focused on the steps. Social innovation, I think, can encompass some aspects of quality improvement, but I think that there's a bigger piece to it, that maybe it's that social justice, social impact that we were sort of talking about, that you alluded to, but it's whether or not something is innovation, I think is a very difficult question, because defining innovation, again, you're going to get a different answer from every single person that you ask. But is it transformative? You know, quality improvement can be transformative, but it's not always. I would say, you know, not all penguins, or all penguins are birds, not all birds are penguins.
Looks like Joanne has a hard line to follow.
I would say too that I think I'm one of these. Okay, I'll do this. That, you know, you might start off with quality improvement, right? And as you're in the process, you're building relationships, you're talking to advisors, you're in the innovation ecosystem, you're then thinking of different scales of impact. So don't, you know, you might not know at the start about the extent or the scale or the reach of your impact that then leads to systems change or getting upstream and working at the root cause. That can come later. So it could be, don't define yourself in the beginning, and it's a journey, and see where you go and sort of where your impact ends up going.
Got one online here. And while we're waiting, Jamie Kaufman, was there anything you wanted to add later about what W20, if W21C has anything coming up with hackathons or the innovation? Think about that while we do this. No updates? Okay. All right. Online question.
So online question from Alexandra Harrison. Is there funding available to help community organizations develop their infrastructure to engage with their community?
Run up here. We're making you work up your appetite for lunch.
I'm one of these. Yes, there is, but we need to have a conversation. So it's not just you apply for the funding and you get the funding and you get the money and you go off and do your business. So I'd love to have a conversation with you about the Social Innovation Initiative. You can contact us. We actually have a webpage. The whole week is dedicated to that page right now, but there is, and it all really, I actually challenge all the researchers to start thinking about their work in a little bit of a different mindset. We're here to be servants, and it's really about serving our community. It's about making change in that community and driving that initiative and creating that impact that really benefits everyone. So community agencies were again, reverse engineering the process to say, what is community looking for? What do they need? And how can they leverage the support from the University of Calgary and its bench strength to drive their missions mandates forward? Because I think together we'll collectively drive positive change. I hope that answered your question.
So this is a kind of a lower scale follow-up to that, but the question makes me think of some of the SHRC partnership funding that's available. So the Social Sciences and Humanities Research Council does have a partnership stream of funding that allows partnerships between the university and other organizations. And the Partnership Engage grant is about connecting with an organization, and some of those funds could be used to support the needs of time at the partner organization. So that could also be, again, needs a further conversation to kind of scope out what that ask is specifically about, but there might be, there's obviously going to be kind of like funds in the community space, but there may also be funds in that traditional academic space that can allow that kind of community impact as well. So might be some interesting conversations in there.
It's a fantastic panel. Two questions. One, is there a red phone? So is there like one number we can dial? And then that'll get us to the right person?
It's walking right.
There really should be an SII bat phone. I agree. There is and there isn't. So this is the point of this whole panel. There is really no wrong door, Tom, and to the broader community. If you connect in with the Social Innovation Initiative led by Dr. Karen Benzies, if you even connect with Stephanie at Knowledge Engagement, Sarah at MyTax, Jamie at W21C, Joanne at Innovate Calgary, Faye at the Hunter Hub, you'll connect to the system essentially. So it's tapping a system because that's really what it takes a village, you guys, to make it work. So hope that answers your question, Tom.
No, that's perfect. And so my follow-up question then is, it's impressive to hear how Dr. Edwards has come to you and navigated the process and has moved her initiative forward. What can an institute like O'Brien do to send you more individuals like Dr. Edwards?
Good question. I think just send them our way and let's have that conversation and dialogue. I don't think any one of us are strangers to listening to the work that's being done here and how we can support in any capacity. And if our system doesn't have an answer, we'll dig in. That's sort of I call the Social Innovation Initiative a little bit of forensic digger. We dig the whole, not only the institution, but also broader community. We're no stranger to Calgary's innovation ecosystem that's available to support great members like Platform Calgary. You've got, Startup Alberta happening as well. So there's a lot of members in our community that can help as well. Just connect with us.
Yeah, you go ahead. And I'll just add, just don't be shy to reach out. Like, don't hesitate, have those conversations, because I think a lot of times people don't know what they don't know, and they're not aware of the resources. And it may not just be social innovation, it may be broader innovation. There may be other connections, there may be other hubs that expand beyond the University of Calgary that this hub can connect you in with. And that can be the start of something even bigger than that. And so as a program, then as a center, that's what we always tell people is don't hesitate and worry about taking up someone's time to have a meeting or grab a coffee and ask the questions, because more often than not, people will come and they think they know what they're looking for. They think they have a sort of a preconceived notion of where they are in that pipeline, and they may not completely understand or know what the resources are that might be available to them. And so just to have a conversation and kind of hash some of those things out can be really, really valuable. And it's not a waste of anyone's time to do that. And I think people more often than not will hesitate with that piece. And it's just do something. It's that idea. So never hesitate to reach out to anybody within this group, or to Tom to connect you into this group. No, but yeah, that's the best advice you can get, is to just kind of do it.
Sorry, just to add one more thing at risk of have too many of us answer. Tom, if there's anyone like yourself, like others in the room who are looking for the kind of support that we are all purporting to offer, we're also happy, I would say for most of us, if not all of us, to come to you. If you're having a faculty meeting or you're having like a monthly call or a quarterly thing, please invite us. We're happy to come and do a 5-minute, a 10-minute, a 20-minute expose of here's the ways that we can help you. Here's how to get in touch with us. Here's when, and to make ourselves more accessible, because often faculty, it's that step too far. They've heard of it, they've seen it, but bringing us in front of them is also a really valuable way that you can connect the dots.
I'm the interloper here. You go first if you have more time.
Okay, thank you. I was just gonna say, well, the way at O'Brien there are I don't know what they're called, when people have an idea, and they could come and meet with a small group. Is that what it's called? Propel? Chalk talks, that's what it is. It occurs to me that could also be an idea when people are like, I think I have something. Turn Chowdhury and I got brave and we're doing Launchpad. So we just started last week. So, but Faye was just, I happened into the Hunter Center my first week here, and Faye was just like so helpful. and introduced me to, and then I was like, oh my gosh, I've talked to a number of people already on, on the panel, but I found it that way, but I just wonder if there could be something internal first. And obviously there's other people that have already had experience, you know what I mean? But I didn't even know because I was, oh, I would have asked you. So I think that's the other thing.
Should we find someone to sit on the panel who has an innovation perspective? Because we don't. We think of it in terms of either content expertise or mentorship expertise, but we generally don't think of it as terms of innovation expertise, which most of us don't have, right? So should we be inviting Faye to come to our Chalk Talks?
There is some precedent for that, where some folks from Innovate Calgary, and I'm sure others, have been asked to sit on review committees for exactly that purpose. So.
So first question, does life really mirror art? Kidding. And it actually, yeah, sure. Okay. So that makes the second question. Is there anyone like this system is doing things? So two thoughts came to mind. This system would be amazing to tap the minds of you about what the barriers are to innovation, because you're tapping into all of those every day. But the second one really is, who do you really annoy here by doing the work that you're doing? Like, is there like something, you know, because you're sort of troublemakers in a way. Yeah. Anyone?
Yeah, so we actually have a shared intake form between Knowledge Engagement Innovate Calgary and the Social Innovation Initiative, which is helpful because then if it's someone that we're recommending to each other, we've already got the data points. We don't have to have you repeat yourself 50 times over, which is really helpful. So that's a good question in terms of disrupting. It is a culture change. It really is. It's a mindset change. It's going to take time, but we were told from our leadership team at the VPR, get out of their way, which is great. So I think we're open to change. We're open to explore. We're open to discover. We're not going to be perfect. We know this. There will be mistakes that are made along the way, but we'll work together to create that sort of disruptive change here at the institution, which is great. And it does come down to how we approach our system as well. So we invite any new members to the collaborative that want to join and want to have a conversation and want to engage and really help mobilize social innovation here at the Institute. But more importantly, we also want to hear from community. So I know that there's a few community members that are online, maybe even here in person, to talk with us to really understand what are we doing incorrectly that's creating a barrier for you, that is not allowing you access to support resources, you know, ideas, etc., that can help you move your mission and mandate forward too. So it's a two-way conversation, never just a one-way. Oh, we're at time.
We came for Peter, but we stayed for the theater. I think we all have a much stronger understanding of what it takes to lead in social innovation and how to do social innovation. I think we've also realized that social innovation requires us to do social innovation to do the social innovation. And so sort of like an inception level social innovation thing going on here. But thank you all for coming. This was a phenomenal event and nice to see people in person as well as online. There's food available for both, but it'll just be harder for the online people to access. So lunch is served.